Dr. Mahima. The guests are arriving. Kindly switch off your phone or keep in silent mode. Kindly do not leave the hall, assembly hall during the program. ದಯವಿಟ್ಟು ನಿಮ್ಮ ಮೊಬೈಲ್ ಫೋನ್ಗಳನ್ನು ಮೌನವಾಗಿಡಿ. ಕಾರ್ಯಕ್ರಮದ ಸಮಯದಲ್ಲಿ ದಯವಿಟ್ಟು ಸಭಾಂಗಣದಿಂದ ಹೊರಗೆ ಹೋಗಬೇಡಿ.
Good morning, everyone. Kindly keep your phones on silent mode. Please do not leave the auditorium during the program. Please be seated. morning, everyone. This is Dr. Mamta.
ಎಲ್ಲರಿಗೂ ಶುಭೋದಯ. ನಾನು ಡಾಕ್ಟರ್ ಮಹಿಮಾ.
A warm and heartfelt welcome to each one of you gathered here today at our Jalappa Silver Jubilee Auditorium. We are honored to celebrate a momentous occasion, centenary birth anniversary of our founder chairman, late Shri R.L. Jalappa ji, and 12th hospital day of R.L. Jalappa Hospital and Research Center. We shall take you through a glimpse of R.L. Jalappa ji's life through a video. Can we have the video, please? Such an inspirational personality is Dr. Sri Jalappa sir. Today is not just about milestones, it's about memories, dedication, and a vision that transformed into an institution of care and excellence, Sri Devaraj's Academy of Higher Education and Research. We now request the dignitaries to please take their seats on the dais. We welcome the chief guest, Dr. R. Vishal, IAS, Secretary of Fiscal Reforms, the Finance Department, Government of Karnataka, to please come onto the dais. Please give him a big round of applause. I request Dr. R. N. Srinathan, the guest of honor, the retired Dean, Professor, and Chair of Anatomy and Neurosciences, onto the dais.
Dr. B. Vengamama, Honorable Vice Chancellor, SDUAHER, Dr. D. L. N. Prasad Sir, Chief Administrative Officer of the University, Dr. C. Muninarayana Sir, Registrar of the University, Dr. Prabhakar K. Sir, Principal and Dean, Sri Devaraj Medical College, Dr. J. Krishnappa, Medical Superintendent, R.L. Jalappa Hospital and Research Center, Dr. K. Dinesh, Deputy Medical Superintendent, R.L. Jalappa Hospital and Research Center, Dr. M. G. Rajkumar, Deputy Medical Superintendent of the R.L. Jalappa Hospital, Dr. G. Manjunath, Consultant and Purchase Officer of the hospital, Dr. T. D. Pawar, Human Resource Manager of the University. Let us begin this auspicious event with a moment of divine grace by invoking the blessings of Almighty. I invite Mrs. Lakshmi to present the invocation song.
Mrs. Tanuja and Mrs. Pushpa, please come on to the dais.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यकलक्षेत्रे गुरुधर्मसदाराध्याय गुरुपुत्रपरित्रात्रे गुरुपाखण्डखण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय गौजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि.
Thank you for this powerful rendition, Mrs. Tanuja and Mrs. Pushpa. Let's now rise for Nadagite, the state anthem of Karnataka, paying a tribute to our rich culture and heritage. I request Mrs. Sudarshini and team to present Nadagite.
जय भारत जननीय तनुजाते जय हे कर्नाटक माते जय सुंदर नदी वनಗಳ ನಾಡೆ जय हे रस ऋषिಗಳ पीडे
so much, Mrs. Sudarshini and team. We request you all to please remain standing for the institutional anthem, a symbol of pride, unity, and our shared vision, for which I call upon Dr. Usha Shenoy and team.
ನಾಡಿನ ಪೂರ್ವ ದಿಗಂತದಿ ಮೂಡಿದೆ ಅರಿವಿನ ರವಿಯುದಯ. ನಾಡಿನ ಪೂರ್ವ ದಿಗಂತದಿ ಮೂಡಿದೆ ಅರಿವಿನ ರವಿಯುದಯ. ಕೋಲಾರಮ್ಮನ ಬೋಧಿಯ ಮರದಡಿ ಅರಳಿವೆ ಎಡೆ ಹೃದಯ. ಅರಳಿವೆ ಎಡೆ ಹೃದಯ. ಅರಳಿವೆ ಎಡೆ ಹೃದಯ. ಚಿನ್ನದ ನಾಡಿದು ದೇವರ ಜರಸು ನಾಡಿನ ಮುಕುಟಮಣಿ. ಚಿನ್ನದ ನಾಡಿದು ದೇವರ ಜರಸು ನಾಡಿನ ಮುಕುಟಮಣಿ. ಧೀರ ಜಲಪ್ಪನವರ ಸಾಹಸಕ್ಕೆ ಮೊಳಗಿದೆ ಜಯಬೇರಿ. ಮೊಳಗಿದೆ ಜಯಬೇರಿ. ಮೊಳಗಿದೆ ಜಯಬೇರಿ. ದಾಸರ ಸಂತರ ಕವಿಗಳ ಕನ್ನಡ ಜನಪದ ನಿರಂತರ. ದಾಸರ ಸಂತರ ಕವಿಗಳ ಕನ್ನಡ ಜನಪದ ನಿರಂತರ. ಉನ್ನತ ವಿದ್ಯಾಲಂಕೃತ ಸಂಸ್ಕೃತಿ ಹರಿವುದು ಚಿರಂತನ. ಹರಿವುದು ಚಿರಂತನ. ಹರಿವುದು ಚಿರಂತನ. ಭವ್ಯ ಭವಿಷ್ಯವ ನಿರ್ಮಿಸಲೆಂದೇ ಬೆಳಗಿದೆ ಜ್ಞಾನನಿಧಿ. ಭವ್ಯ ಭವಿಷ್ಯವ ನಿರ್ಮಿಸಲೆಂದೇ ಬೆಳಗಿದೆ ಜ್ಞಾನನಿಧಿ. ವಿಶ್ವ ವಿನೂತನ ವಿದ್ಯಾಚೇತನ ತುಂಬಲಿ ವಿಶ್ವದಲ್ಲಿ. ತುಂಬಲಿ ವಿಶ್ವದಲ್ಲಿ. ತುಂಬಲಿ ವಿಶ್ವದಲ್ಲಿ. ಸಾಧನೆ ಶೋಧನೆ ಬೋಧನೆ ಪಥದಲ್ಲಿ ಹಂಚುತ್ತ ನವನಿಧಿಯ. ಸಾಧನೆ ಶೋಧನೆ ಬೋಧನೆ ಪಥದಲ್ಲಿ ಹಂಚುತ್ತ ನವನಿಧಿಯ. ಅಜ್ಞಾನದ ತಮವಳಿಯಲಿ ಸತ್ಯದ ಬೆಳಕಿನ ಶುಭೋದಯ. ಬೆಳಕಿನ ಶುಭೋದಯ. ಬೆಳಕಿನ ಶುಭೋದಯ. ಬೆಳಕಿನ ಶುಭೋದಯ. ಬೆಳಕಿನ ಶುಭೋದಯ.
Thank you, everyone. To formally welcome you all to this occasion, I now invite Dr. Dinesh K, Deputy Medical Superintendent of the hospital, to welcome the gathering.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Respected dignitaries on the dais, esteemed guests, faculty members, staff, and dear students, good morning to everyone. It gives me immense pleasure and pride to extend a warm welcome to all of you on this significant occasion. The centenary birth anniversary of our beloved founder chairman, late Sri R.L. Jalappa ji, and the 12th Hospital Day celebration of R.L. Jalappa Hospital and Research Center. I extend my gratitude to our chief patrons, Sri G.H. Nagaraja, Honorable Chairman and Chancellor, Sri Devaraja's Academy of Higher Education. Sri J. Rajendra, Vice Chairman, Sri Devaraja's Educational Trust. Sri K.G. Anmantaraju, Honorable Secretary, Sri Devaraja's Educational Trust. And also to all the esteemed trustees and their family members. Your visionary guidance and persistent support continue to inspire the growth of our academy and hospital. We are deeply honored to have with us our Honorable Vice Chancellor, Dr. B. Vengamma, who has graciously consented to preside over this function. Your presence and continued guidance inspire excellence across all spheres of our academy. Welcome you, Madam. At the outset, I have the honor of welcoming our today's chief guest, Dr. Vishal R., IAS, Secretary Fiscal Reforms, Finance Department, Government of Karnataka. Sir, your flair of academic excellence and esteemed presence enriches our celebration with wisdom, insight, and grace. I welcome you, sir. I welcome our today's guest of honor, Dr. R.N. Srinathan, retired Dean, Professor and Chair of Anatomy and Neurosciences, whose decades of dedicated service continue to inspire generations of medical professions. Welcome you, sir. A warm welcome to our distinguished patrons, Dr. D.V.L. Prasad, Chief Administrative Officer. We deeply admire your commitment and exemplary service to our institution. Dr. C. Munirana, Registrar, your dedication continually strengthens the excellence in our academy. Faculty members, Dr. Prabhakar, Principal and Dean, an outstanding academician inspiring excellence in every learner, a guiding force ensuring academic brilliance. Dr. G. Manjunath, Consultant, R.L. Jalappa Hospital, Procurement Officer, SDUAHER, a respected professional committed to institutional growth and operational excellence. Arvind Natarajan, Dean Allied Health Sciences, a forward thinker driving innovation and interdisciplinary excellence. Dr. J. Krishnappa, our medical superintendent, is the man of the architect of today's function, an eminent teacher and a clinician whose guidance ensures seamless healthcare services. Dr. Rajkumar, my colleague, Deputy Medical Superintendent, a young mind with dedication and vision. Dr. Zeenat Kerina, Chief Nursing Officer, an empathetic professional committed to delivering excellence in patient care and nursing education. Dr. Srinivas Reddy, Resident Medical Officer, a senior professional with modern thinking and vision. I am happy to welcome our former principal, Dr. P.N. Sriramulu. I also welcome our former medical superintendent and my teacher, Dr. Lakshmaya. Dr. Azim Moinuddin is also our former medical superintendent. Dr. S.R. Sheila, she is also our former medical superintendent. I welcome Director of Academics, Postgraduate Studies, Director, CDLS, Central Skills Lab, Super Specialty Services, Infertility Clinic, Trauma Center, DNB Coordinator, Director Sports and Student Welfare, Director MRD, Director Genome Lab, Director R&I, Director UDOM, Quality Manager, Director of Oncology Services. A warm welcome to Dr. Vijay Lakshmi, Principal, Jalappa Nursing College and their staff. Mrs. Lakshmi Bhatt, Principal, Jalappa Central School. Dr. Ashok Kumar, Principal, Jalappa College of Pharmacy and their staff. Dr. Kaushik, Principal, School of Law and I welcome Dr. Venkatramana, Brains Institute Director. Welcome you, sir. I would like to welcome all the respected officers of the Academy, various committee members, heads of the department, unit heads and section heads, and all the teaching staff, non-teaching staffs, nursing and paramedical staffs. It is my duty bound to welcome all the staff who have completed 20 years of glorious, uninterrupted service in our hospital. They will be felicitated later. I also welcome all the postgraduates, interns, undergraduate students, medical and allied fraternity. I welcome our General Manager, Mr. Etish. I welcome our Finance Officer also. I welcome our Senior Operational Manager, Brahmanandam Reddy and team, Chief Librarian and team, Engine Section, Estate Section, Security personnel and other supporting departments, including the Finance Department. I extend my hearty welcome to the members of print and electronic media, photography team and all the volunteers for today's program. Over the years, Jalappa Hospital and Research Center has grown into a premier health institution, providing affordable and quality medical services to the poor and needy, while serving as a teaching hospital par excellence. As we move forward, let us continue to serve humanity with humility and dedication, keeping alive the noble ideals of our beloved founder, Jalappa ji. Once again, I extend a warm welcome to one and all present here. Jai Hind, Jai Karnataka.
Thank you, sir, for your warm and gracious welcome. We also welcome Dr. Dinesh, sir, Deputy Medical Superintendent, Jalappa Hospital. Please welcome, sir. Let us now light the ceremonial lamp as symbol of knowledge, positivity, and new beginnings. I request our dignitaries on the stage to do the honors.
Medical Superintendent, Jalappa Hospital and Research Center, to please present the report. Over to you, sir.
ಚೇಂಜ್ ಇದು ತೋರಿಸ್ಲಿಕ್ಕೆ ಇಲ್ಲ ಇಲ್ಲ ಚೇಂಜ್ ಮಾಡಿಕೊಡಿ ಇದು ಹಿಂಗೆ ತೋರಿಸೋಕ್ಕಾಗುತ್ತಾ ಡಿಸ್ಪ್ಲೇ ಸರ್ ಗುಡ್ ಮಾರ್ನಿಂಗ್. ಬೆಳಗಿನ ಶುಭ ಇದಳುಗಳು. ವೇದಿಕೆ ಮೇಲೆ ಇರುವ ಎಲ್ಲ ಗಣ್ಯ ವ್ಯಕ್ತಿಗಳೇ, ಡಿಗ್ನಿಟರೀಸ್ ಆನ್ ದಿ ಡಯಾಸ್, I am Dr. Krishnappa, Medical Superintendent, presenting Hospital Report 2024 and 25. Honorable Vice Chancellor B. Vengamma Madam, Chief Administrative Officer D.V.L.N. Prasad, today's Chief Guest Dr. R. Vishal, Guest of Honor Dr. Srinathan, Registrar of the University C. Muninarayana, Dean Principal of the Medical College Dr. K. Prabhakar, Dean AHS Dr. Arvind Natarajan, my colleagues Dr. Dinesh and Dr. Rajkumar, and all the head of the departments, head of the units, my dear colleagues and members of the academy, teaching and non-teaching staff, dear students and friends from the media, our respectful homage and tribute to R.L. Jalappa ji, founder, chairman, R.L. Jalappa ji was a renowned politician, philanthropist, educationist, humanitarian, and social reformer. He is the founder of R.L. Jalappa Hospital and Research Center in Kolar to provide accessible, high-quality health care for rural communities. Established Sri Devaraja's Academy of Higher Education and Research to promote quality medical education and uplift marginalized communities. His visionary leadership greatly enhanced rural development and healthcare accessibility. In the year 1984, champion of cooperative movement, established Sri Devaraja's Education Trust for backward classes to focus on medical education and social service. In the year 1986, he established Sri Devaraja's Medical College, and in 1994 started R.L. Jalappa Hospital and Research Center, and it is upgraded to the deemed to be university in 2007, and at present our hospital is a super specialty hospital and it is a university hospital. Our vision to be a center of excellence for offering quality patient care, clinical teaching and scientific medical research, stands as a well-equipped tertiary care referral center to the preventative and curative health needs of the people of this region. This is R.L. Jalappa Hospital. It provides accessible, high quality health care to the people of Kolar, neighboring districts and nearby states of Andhra Pradesh and Tamil Nadu. It is a 1,200 bedded tertiary care multi-speciality university hospital attached to Sri Devaraja's Medical College, serves economically backward areas with affordable high-end tertiary health care meeting the global standards. It collaborates with healthcare research, contributing to the advancement in medical science. See, our commitment is, it focuses super specialty excellence, innovation, and trust with treatment with compassion. This is our infrastructure. Our hospital has got hexagonal complexes. See, we got a different blocks. Ashwini block comprises OPD and emergency medicine department. Dhanvantri block, so all the inpatient wards. Sanjeevani block, operation theatres and intensive care units. Chanukya block is a central diagnostic laboratory, physiotherapy and speech pathology and audiology. Sushita block, OBG, OT and labor room and OBG, OT. So then Charaka block, so it contains radiation oncology. These are the different blocks, so with floor-wise distribution of the departments. Our hospital statistics, so the average per day is, OPD outpatient is 2,208. The inpatient average per day, 950 per day. So 1 year statistics of our hospital, that is during 2024-25, the outpatient, so 5,36,000 outpatients are treated. Inpatients, 3,35,000 admissions. Emergency care, so given to 28,900 and add patients. 3,000 and add deliveries per year. Our laboratory services, they analyzed 2.1 million samples. 37,000 major surgeries and minor surgeries conducted in our hospital. Radiological investigations, 1,30,000 radiological investigations are performed in our hospital. This is the hospital statistics of 1 year. Our services, broad specialty services, super specialty services, diagnostic services, and supportive services. We have broad specialty services, general medicine, surgery, obstetric and gynecology, anesthesiology, emergency medicine, dermatology, ophthalmology, orthopedics, so ENT, psychiatry, respiratory medicine, dentistry, and radiotherapy. You have super specialties, critical care, neurology, neonatology, nephrology, medical and surgical oncology, pediatric surgery, plastic and reconstructive surgery, urology, endocrinology, hepatopancreatobiliary and liver transplant, immunohematology and transfusion medicine services. Our diagnostic services, so CT scan, mammography, MRI, ultrasound, X-ray, audiometry, clinical biochemistry, clinical microbiology and clinical pathology, toxicology, EEG, ENMG, spirometry services, urodynamic studies, bronchoscopy, laparoscopic services, and colonoscopy services. Our supportive services include the ambulance services, pharmacy, medical records department, and clinical nutrition. We have rehabilitative services, physiotherapy, speech pathology and audiology, de-addiction center, and Center for Chronic Mental Illness. Our emergency medicine department, the concept is treatment first, payment next. The emergency department is staffed by an experienced team of doctors trained to handle a wide range of emergencies and trauma cases. The staff promptly triages and treats all emergencies with urgency using advanced trauma life support protocols, and other critical procedures to provide rapid life-saving treatment. Near our emergency departments, we have got a pharmacy outlet for the benefit of our patients. Jalappa Hospital Critical Care Unit, it is a 36-bedded, fully equipped for advanced critical care, staffed by a team of highly experienced intensivists. We have got 16 state-of-art operation theaters equipped with cutting-edge technology capable of performing wide range of surgical procedures. Our Central Diagnostic Laboratories, it is NABL accredited laboratory. So it has microbiology, pathology, biochemistry laboratories, continues to advance laboratory medicine by adopting modern diagnostic that provide faster, more accurate, and patient-focused care. So our laboratory has got WITEC, an automated system, which gives rapid microbial identification and antibiotic susceptibility testing. Jalappa Hospital focuses on leveraging cutting-edge technology for improving patient care and better health outcomes. Our imaging services, the CT scan, most advanced and cutting-edge technology with 128 slice CT scanner, so that helps for reduced radiation exposure through dose optimization for patient safety and faster emergency diagnosis for crucial prompt interventions in conditions like traumatic injuries, internal bleeding, and other clinical conditions. The Immunohematology and Blood Transfusion Department supplies blood and blood products required for our hospital. More than 15,000 units of blood is transfused in our hospital. It is equipped with advanced technology for apheresis, for giving single donor platelets and plasmapheresis procedures. We have hemophilia clinic, which offers specialized care, including clotting factor therapy and regular monitoring for patients with hemophilia. We have got Thalassemia Day Care Center, provides regular blood transfusions, chelation therapy, comprehensive care to enhance the quality of life of our thalassemia patient. So it is a free of cost. The blood transfusion and the factors for these patients are given free. So our hospital has got hospital information management system from Iosta company. The software is Backbone, which provides over 25 modules ranging from registration to discharge. So our doctors will give digital prescriptions. We have a real-time dashboard and mobile application. Department of General Medicine, the department gives comprehensive care for acute and chronic illness through the outpatient, inpatient, and the emergency services. It runs specialty clinics for diabetes, thyroid, geriatrics, infectious diseases, and preventative health, so outreach activities and also camps. So our Department of General Medicine, General Surgery, so it provides surgical care for a wide range of conditions involving abdomen, breast, thyroid, soft tissue. It offers both elective and emergency surgical services with modern operation theaters and post-operative care. The department also conducts specialty clinics, promotes minimally invasive surgeries, and ensures multidisciplinary collaboration for better patient outcomes. The Department of Orthopedics, it offers a comprehensive orthopedic services across the multiple specialties, which includes arthroscopy, arthroplasty, complex trauma and spine surgeries, and so pediatric orthopedic surgeries. The Department of Obstetrics and Gynecology, so well-equipped infrastructure with highly competent faculty who are known to manage all high-risk cases referred from periphery and conduct more than 350 deliveries per month. The department runs infertility clinic, well-woman clinic, general gynecology, cancer clinic, menopause clinic, adolescent and endocrine clinic. The Department of Pediatrics, excellent infrastructure with the state-of-art 32-bedded neonatal care unit. So 15-bedded mother neonatal intensive care, 16-bedded pediatric intensive care unit, and 75 general beds. The department also runs endocrine clinic, the child rehabilitation clinic, hemato-oncology clinic, and high-risk newborn follow-up clinic. The Department of Ophthalmology, so I got clinical subspecialties like cornea clinic, retina, glaucoma clinic, pediatric and squint management, oculoplasty. So they perform eye-end surgeries. The Department of Otolaryngorhinology and head and neck surgery. So they include advanced head and neck oncological surgeries, endoscopic sinus surgeries, micro-ear and skull-based surgeries. So they have advanced coagulation-assisted adenotonsillectomy and sleep apnea surgeries. So the Department of Anesthesiology provides anesthesia care to all the surgical departments, and they have got a ultrasound-guided nerve blocks, the pain clinic, etc. So the Department of Urology provides advanced diagnostic and treatment for urinary tract infections and male reproductive disorders. Utilizing minimally invasive and endoscopic techniques, the team manages cases such as renal calculi, prostatic enlargement, urological malignancies, and infertility. We have an MCH program in the department from 24-25, 3 seats. The Department of Nephrology and Dialysis Services gives a comprehensive kidney-related conditions, especially end-stage renal disease. So we do more than 1,000 hemodialysis per month. State-of-art facility with 24 advanced dialysis machines are available, offers regular hemodialysis and peritoneal dialysis, maintain the patient health and quality life. Hospital received official license to perform the kidney transplantation. We got a license from Government of Karnataka. The Department of Oncology provides comprehensive oncological services. We have surgical oncology, which performs complex cancer surgeries. During the last year, we got MCH program in the surgical oncology. The medical oncology provides chemotherapy, targeted therapies, and immunotherapy for holistic personalized treatment. The radiation oncology used advanced LINAC for precise radiation therapy, enhancing effectiveness and minimizing side effects. Majority of our cancer patients are treated under the government schemes, so like Ayushman Bharat, etc. So we have got linear accelerator. So the installation of the state-of-art linear accelerator represents a major upgrade to our radiation oncology department. This advanced technology allows us to deliver highly preserved conformal radiation therapy, improving our capacity for effective cancer treatment while significantly reducing damage to the surrounding healthy tissues. We have got MOU with Brains Neurology, Bangalore. So the team of Brain Institute doctors will perform neurosurgical services round the clock, covering all the neurosurgical emergencies and complex brain and spine surgeries. We have a Department of Neurology, headed by our VC Madam, so dedicated to diagnosis and management of neurological disorders like stroke, epilepsy, migraine, neuropathy and movement disorders. So our center has got advanced neurodiagnostic facilities like ENMG, so EEG, neuroimaging support. So we have got a neuro rehabilitation center, specialized unit for rehabilitation of patients with neurological impairment. Our department has got plastic and reconstructive surgeries, specializes in restoration and reconstruction, which significantly improves functional and aesthetic aspects of patient care. The department utilizes advanced technology for reconstruction surgeries, addressing trauma, congenital deformities, post-traumatic reconstructions, hand surgery, and cosmetic surgery. Department of Gastroenterology, it is dedicated to the management of gastrointestinal tract and liver disorders. So utilizes the latest diagnostic tools and therapeutics. It has got a state-of-art technology enabling complex procedures with precision and faster recovery. So we have got a cardiology department, which is outsourced to the Narayana Hrudyalaya. So they are performing all types of the cardiac as well as the cardiosurgery procedures. The Department of Endocrinology, dedicated to the management of hormonal and metabolic disorders like diabetes, thyroid disorders, adrenaline disorders, pituitary gland disorders, and reproductive hormonal imbalances. So we have started new services like infertility clinic, so clinical trial center, dermatology department started laser therapy, and we have got a hepato, pancreato, biliary and liver transplant unit recently started. We have adult vaccination center along with the child vaccination center, diabetic foot care management. We have a mobile health unit and memory clinic. Our adult vaccination center provides comprehensive immunization services for adolescents, adults and elderly. The center aims to prevent vaccine-preventable diseases and protect high-risk groups, including pregnant women, healthcare workers, and patients with chronic illness. We give HPV vaccine to the adolescents and also the women within 26 years of age. Recently, we had a HPV vaccination drive, created awareness and started giving this vaccine in our center. In the dermatology department, uses laser therapy for their advanced treatment of patients. We have got hepato, pancreato, biliary and liver transplant unit, recently started and inaugurated, so they are doing a very good job. So we have mobile health units, started in January 25. So every day they will treat 90 to 110 patients, and it covers remote rural areas where the patient not able to come to the hospitals. So already treated 8,000 and add patients in remote villages. We have got diabetic foot care clinic, so it is a multi-speciality unit. Poison detection center aids the physician by providing rapid toxicological results and guidance for the managing physicians to treatment of the poison cases, significantly improving the survival outcomes. Currently analyzed more than 100 samples in poison detection center. We have started the trauma intensive care unit. It is a 6-bedded critical care facility available in our emergency department. In the child rehabilitation clinic, the child rehabilitation clinic focuses on children with cerebral palsy, intellectual disabilities, providing multidisciplinary therapy, including physiotherapy, occupational therapy, and speech language therapy. With over 160 patients are registered in the center, so they will have interventions improving the motor, cognitive, and communication skills, promoting independence and integration into their daily life. So we have got the nutrition clinic, delivers individualized dietary consultations supported by advanced tools for body composition and fat distribution analysis. Experienced nutritionists collaborate with clinical departments to provide therapeutic diet plans tailored to each patient's condition, ranging from metabolic disorder to the post-operative recovery cases. We have got a master health checkup, offers comprehensive master health checkup package, which includes a wide range of health assessment and laboratory investigations tailored to the needs of the government officials, corporate professionals, and general public. So we have got all the companies, they will come for annual health checkup of their employees. We have a clinical trials center. The center dedicated to the facility for conducting ethically approved clinical and research activities. The center operates in compliance with good clinical practice guidelines, ICMR regulations, and ethical standards laid down by the Institutional Ethical Committee. We have got a memory clinic, specialized care for memory-related disorders, focusing on the early detection and management of dementia and cognitive impairment. It is a multidisciplinary approach integrating with psychiatry, neurology, geriatrics, internal medicine, and clinical psychology. It supports the caregivers and the families, promoting awareness and strategies for better quality of life. So we have got anti-retroviral therapy center. It is approved by NACO. The hospital has initiated ART center dedicated to the management of the patients living with HIV and AIDS. The center provides ART drugs free of cost, regular viral load is monitoring, counseling services aim to improve the quality of life and treatment of the patients. The totally number of cases registered in our center is 164. They are all taking free drugs from our center. The infertility clinic, at present it is a level 1 infertility clinic. So it provides comprehensive fertility care for the couples. So we are facing the reproductive challenges. Services include ovulation induction, intrauterine insemination, hormonal evaluation, and fertility preservation. Numerous couples have benefited from these services with a focus on ethical practice, advanced technology, and personalized patient care. The center remains committed to helping the couples realize their dream of parenthood. Already we have registered 495 patients in our infertility center. The pediatric hemato-oncology and hemato-oncology unit, the division is dedicated to the comprehensive care of children with blood and cancer patients. The pediatric surgery at Jalappa Hospital provides comprehensive surgical care for infant, children, and adolescents with congenital and acquired surgical conditions. We are providing a universal newborn hearing test, aims for early diagnosis and timely intervention to enhance speech, language, and developmental outcomes. Uses acoustic emission and automated audiometry brainstem response. We have got tobacco cessation center, provide counseling, behavioral therapy, pharmacological support through an advanced evidence-based approach. Aims to promote healthier, tobacco-free Kolar through preventative and community-oriented healthcare. We have a dedicated nursing team. So, vital pillar of our Oral Joy Hospital proudly upholds the legacy of our founder chairman, Sri Jalappa ji, on the momentous occasion of Centenary celebration for hospital. This is the picture of nursing department. So we give free services and services at the reduced rates. The outpatient services, the OPD card are free, OPD doctor consultation free, general health checkups we conduct. So we conduct the regular health checkup at Jalappa, Antargange and Kantaraja Circle old age homes. So we have got free health eye camp in different areas of the rural areas. So inpatients, free services. So general ward bed charges are free. General ward doctor consultation charges are free. The general ward surgeries, deliveries, both normal and cesarean deliveries are free of cost. We conduct rural health camps. So our services at discount rates, like radiology, you got the CT and MRI are at the discounted rates. So hysterectomy and other general surgery package, you got a 5,000 rupees packages are available. So we treat our patients with government schemes and insurances. So the government schemes like Arogya Bhagya scheme. So Ayushman Bharat, Arogya Karnataka, there are so many schemes available in the government. You utilize that schemes. You got a private third-party insurance schemes. And we got a MOUs with the different companies to provide good health care to those company employees. Our hospital is NABL and NABH accredited hospital. The NABH accreditation from the Quality Council of India. Our advanced skill laboratory will provide hands-on training in BLS, ACLS, PALS, NALS, advanced simulation and mock drills we conduct regularly. So we got an MOU with National Institute of Mental Science, that is NIMANS. We got MOU with Narayana Vidyalaya. We have got MOU with Brains Super Speciality Hospital in Bangalore. So they are doing all the neurosurgical procedures. So we got MOU with Genia Fertility Center. Our quality cell regularly conduct mock drills like fire mock drill. We conduct code pink mock drill. We conduct code brown. So for the external mass casualties, how we can manage the mock drills we conduct regularly. We conduct code blue mock drill. So we got a certificate for conducting eye bank and keratoplasty and renal transplantation. Our hospital received prestigious awards. One is a National Patient Safety Award 2025 for category in the innovation in quality. We got Precision Med India National Award 2025 in the category of Emerging Hospital of the Year in Precision Medicine. Our institutional responsibilities include free treatment to all poor patients, free drugs, free food supply 3 times daily, and we provide ambulance services to the trauma and perinatal patients up to 25 kilometers. We regularly conduct national and international health programs. So we conduct No Tobacco Day and ORS Day. Number of health camps conducted in the periphery. The health camps, more than 1,100 health camps are conducted in the rural areas. 40,000 people got benefit of this. Our medical students can have a family adoption program. So body donation we encourage to our public regarding and also create awareness for the body donation. The sports and cultural events conducted during our Centenary celebration and Hospital Day. These are some images of sports events and cultural events. So future plans. So among services, number one is starting the robotic surgery is a plan. To start PET scan in our hospital, telemedicine, starting of cosmetology clinic, starting of cochlear implant program. We want to go to JCIA accreditation. So starting the respiratory rehabilitation services, level 2 infertility clinic, liver and bone marrow transplant services, pediatric ophthalmology and squint surgery, planning to start human milk bank, fetal medicine unit in our hospital, interventional radiology, de-addiction center, ear transplantation services, planning to start disability screening camps, cancer screening camps, rheumatology clinic, SMILE program. So plan to go for EMR and we want to start a hospital museum. Regarding the education programs, to start MCH program in neurosurgery and plastic surgery, DNB in critical care medicine, DM course in endocrinology, DM in medical oncology, MD in radiation oncology, MD in pulmonary medicine. These are the future plans. At the outset, I want to express heartfelt thanks to the former medical superintendents, Dr. Borappa, Dr. Lakshmaya, Dr. Sriramulu, Dr. Sheila, Dr. Azim, Dr. Mohan Kumar, for their contribution in developing our hospital. At the outset, on this occasion of the Founders and the Hospital Day, the team at R.L. Jalappa Hospital and Research Center pledges to honor our Founders' vision by serving humanity with unwavering compassion and commitment. Thank you one and all for patient hearing. Thank you.
Thank you so much for that elaborate report, sir. We welcome Dr. Borappa, sir, the former long-standing medical superintendent of R.L. Jalappa Hospital and Research Center. We welcome you, sir. I now request Dr. DVLN Prasad, sir, Chief Administrative Officer, SDUAHER, to please address the gathering. Over to you, sir.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Most respected dignitaries on the dais today, namely the Honorable Madam Vice Chancellor of the Academy, distinguished chief guest of today's function, Dr. Vishal, IAS, Secretary, Physical Reforms and Finance Department, Government of Karnataka, Dr. Srinathan, founder, Professor of Anatomy, Sri Devarajas Medical College, Registrar of the Academy, Dr. C. Munnarayana, Hospital Consultant and Honorable Executive Council Member of the Academy, Dr. G. V. Manjunath, dearest Principal and Dean Faculty of Medicine, Sri Devarajas Medical College, Dr. Prabhakar, Dean Allied Health Sciences, Dr. Arvind Natarajan, Deputy Medical Superintendent of Oral Jalappa Hospital, Dr. Dinesh and Dr. Rajkumar, Chief Nursing Officer of the hospital, Dr. Zinath, Dr. Venkatramana, leading neurosurgeon, and all the learned faculty members who are sitting in front of the dais, doctors, nurses, unit heads, unit chiefs, all the directors, paramedical staff, non-teaching staff, and principals of the constant colleges of the academy, Pharmacy College Principal Dr. Ashok Kumar, Nursing College Principal Dr. Vijay Lakshmi, and Law College Principal Dr. Kaushik, Principal of Oral Jalappa School Dr. Lakshmi Bhatt. I recognize the presence of Finance Officer of the Academy Dr. Rajaram, HR Dr. Nayak, former Head of the Department of Medicine and Medical Superintendent Dr. Lakshmaya, former Medical Superintendent Dr. Borappa, the RMO Srinivas Reddy, Chief Librarian, and other invited dignitaries, dear students, press and media people or persons. Very good morning to one and all. I take this proud privilege in welcoming each and every one of you on behalf of the Chancellor of the Academy, management, trustees, and administrative authorities of the Academy. It is my proud privilege to associate myself with all of you for today's function. And today, all of us gathered here to celebrate a remarkable milestone, the centenary celebrations of our great departed leader, Sri R.L. Jalappa ji. My dear all, today's event is not just a celebration, it is a great tribute what we extended to the legendary personality and man of compassion. R.L. Jalappa is a man of great vision. His vision transformed rural health and education. He believed strongly that rural health as well as education are the two strong pillars of the nation. He dreamed of a society where the medical education is accessible to all and health care reaches each and every doorstep of the needy people of the society. My dear respected gathering, what you are seeing here today, this great medical institution, this good teaching and quality service delivery hospital comprising of commendable, dedicated, qualified, sincere doctors, nurses, paramedical staff who are rendering their valuable services to the needy people or needy patients round the clock. And this flourishing university are the true live reflections of his dream. Through this medical college and hospital, he created not just an institution, but a movement for compassion, a movement for discipline, and a movement for compassion and honesty and sincerity. So, my dear doctors and students, today, as you stand in this great temple of learning and healing, let us remember the white coats what you are having is not a symbol of your profession. It is a promise of compassion. All of you know that medicine is not only a science, but is an art of compassion. My dear doctors, every patient you treat, every student you guide, every life you heal, continued is mission of service to humanity. My dear doctors, you are the real strength and pride of our institution. You are blessed with good healing power in your hands. With your kind and affectionate words, you will create a comfortable zone to the patients, and patients will get inspired through your attitude. My sincere request to all of you, keep serving with passion and compassion. Definitely success will follow naturally. So on this momentous occasion, let all of you take a pledge that you will practice medicine with ethics, empathy, and excellence. R.L. Jalappa ji, life history, all of you know, teaches us the greatness of a person is not measured by his wealth and position. It is measured by his sincerity, dedication, attitude, hard work, service, and help rendered to the society. So, my dear all, let us, all of us, become the torch bearers of his noble vision and inspired by him. My association with the legendary person R.L. Jalappa, nearly about 30 years, from 1988 to 2018. My association still becomes stronger with him from 2007 onwards, when the institution becomes the deemed to be university. Whenever he used to travel from Kolar to Bangalore, I was at that time as the control of examinations. he used to call me, "Come Prasad, we'll go to Bangalore." We both of us travel in his Mercedes. During his travel, he used to tell a lot things about his childhood days and also about his political careers, both as a MLA, MP, state minister, and central minister. He always remembered his school days and college days. Always he used to tell me, "I'm an old-timer BA from Maharaja College of Mysore." He studied there only. And further, he always remembered his English teacher and Kannada teacher. I think Dr. Lakshmaya knows me. Usually in every day evening, we used to sit in the corridor of college. We used to have a gulab jamun and one curd vada. He used to tell all these things. What, Lakshmaya, am I right or not? And he liked and he give very much importance to the dress code, dress sense. And he liked always William Shakespeare's one-act plays. He used to always tell his writings like Julius Caesar, Macbeth, Othello, The Tempest. And he always played Brutus' character in Julius Caesar. He used to tell Brutus is the real hero in Julius Caesar one-act play. And even though at last moment he backstabbed the Julius Caesar, he is a good leader. He was a good leader, he used to tell. And he prizes his all qualities. Those are the golden days I am remembering now in this momentous occasion. And also, he used to tell me three important things. Prasad, you remember these three. The one is leadership. The second one is success. And third one is greatness. So in his view, I used to ask, so what is the meaning of all these things? Please explain me. He said, leadership means service. Success means sharing. And greatness means what we're given back to the society. So, my dear colleagues, on this auspicious moment, let all of us salute to his legendary and really dedicate ourselves to follow his mission of humanity, empathy, and excellence, and reaffirm to dedicate ourselves to carry forward his legacy in treating each and every patient. With these few words, I take this opportunity to extend my sincere gratitude and thanks to the medical superintendent and his organizing committee of today's function for extending their kind invitation to be a part of this program. Thank you one and all. Jai Hind, Jai Karnataka.
Thank you so much, sir. It's now time for the official release of the dossier. May I now request the dignitaries on the stage to kindly unveil the report and hospital newsletter. Down.
Thank you, dignitaries. I now invite Dr. Arvind Natarajan, sir, Dean, Faculty of Allied and Healthcare Professions, to introduce the chief guest for the day.
Good morning, everyone. It's my great pleasure and honor to introduce our chief guest, Dr. Vishal R., IAS 2004 batch, Karnataka cadre. He was born on 28 May 1977 in Hubballi. He completed schooling from St. Mary's School and college from P.C. Jabins College. He completed medical graduation from Karnataka Institute of Medical Science and was topper in preventive and social medicine, surgery, obstetrics and gynecology. And Sir also secured top ranks in postgraduate entrance examination, AIMS, PGIMER and NIMANS. During that time, he was the only candidate in India to qualify for both MCH and DM at NIMANS. He cleared civil service examination in 2003 and secured 14th rank. During his 21 years of distinguished service, he has held key administrative positions including Deputy Commissioner in 5 districts. He also heads the departments in UDD and RDPR and Education departments. And Sir also serves as a secretary to Honorable Chief Minister of Karnataka. During his tenure, he has successfully handled various complex and challenging assignments across the various sectors. Currently, he serves as a secretary in Finance Department, Fiscal Reforms, Government of Karnataka. He is also a director of Fiscal Policy Institute, secretary, Karnataka Public Service Commission, and member secretary in Karnataka for Regional Imbalance Redressal Committee. His interest includes reading, mentoring, and addressing administrative challenges. I thank the organizing committee for giving me the opportunity to introduce Dr. Vishal R., IAS. Thank you.
Thank you, sir, for sharing the inspiring journey of Dr. Vishal, sir. It is now our honor to hear from our chief guest, Dr. Vishal R., sir. We request you to address the gathering.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Very good morning to you all. A very difficult Sunday morning. All of you have been made to come to listen to good old stories from us. But privilege being here for multiple reasons. Dr. Arvind, one of the most succinct, very nice introductions, because people say so many things about me. I'm wondering whom they are talking about. So you got it right. Anyway, thank you for that. Very inspiring to see Dr. Vengamma here. When I was chatting up with her, I realized there is this very famous movie regarding Margaret Thatcher during the Falkland Wars. You've heard of the Falkland Islands in Argentina? So this Meryl Streep plays the role of Margaret Thatcher. She uses her term, this lady is not to turn, this lady is not to turn. So when everybody says, let's not do this, let's not precipitate, she takes that decision. Madam, inspiring to have you here as the Vice Chancellor. Thank you. My good friend Dr. Manjunath, we know each other from the last 10, 12 years. In Chikbalapur, I was the Deputy Commissioner of Chikbalapur district also. Very nice, very public-minded, oriented. So pleasure, Dr. Manjunath, that you give me the privilege of coming over here. Thank you. There are legends in cardiology, there are legends in cardiothoracic, there are legends in neurosurgery. Dr. Venkatramana. Thank you, Dr. Venkatramana, to being here and coming on stage. The dignitaries on the dais, off the dais, ladies and gentlemen. ಒಂದು ದೃಷ್ಟಿಕೋನ ಇದೆ. ನಾವೇನು ಮಾಡ್ತೇವೆ ಸರ್ಕಾರದಲ್ಲಿ, when we are in government, I see two things, we try to do two things. First, how do I get the best out of you? How can I give you the best? This is the key. So today when I was walking through your thing, I was just thinking, how do I learn something from this institute, this organization, which I can extrapolate in government, and how from government I can help you out? This is the fundamental way you need to do. Why? Because if I help you succeed, you actually, without realizing, help me succeed. Okay? Professor Dr. Jalappa, we all call everybody Professor, Mr. Jalappa. 100 years back, this gentleman, he was up to 97 years of his age. 3.5, 4 generations he has served in public service. Every generation there is a change. What was there in my generation is different from yours. But what happens in your generation is, if you build well on my generation, if you take the best out of my generation, reduce the bad out of my generation and become better. Whether it is the doctors, whether it is the paramedical staff, whether it is the nursing staff, your thing is, how do I become better at what we do? This is the bottom line. Now, I do not say, no, I will only do this. Do what you like. Do what you love. I was discussing with Dr. Vengamma, what is the difference between her generation, I'm an intermediate, and the new generation. Her generation worked. Wealth came. My generation was lucky to do some work and get wealth. The present generation is slightly wealth driven. I would only request you, take the best out of madam's generation. Take something out of her generation. You'll end up being more happy. Okay. There was this guy, you have heard of John Lennon of the Beatles? Kelidira, Beatles and the bada famous group itto. Okay, so the older generation say yes sir. Just like you have Britney Spears and Ed Sheeran, everything, we had the Beatles. So John Lennon, when he was a kid, so he goes to school, so his teacher asked him, John, what do you want to be in life? He said, happy. So teacher said, no, I don't mean that. You've not understood my question. So John says, no teacher, you've not understood my answer. The purpose of life is to be happy. Do things which make you happy, everything flows in. This is my one and only message to you today. I will not bore you in things. If you have any questions, I'll take 2-3 questions, then I'll go take my seat. Do you have any questions, please? Oh, sir. Professor Hanmantayar. Please. Can you give him a mic, please? I would request you. And it's compulsory, 1 or 2 ladies have to ask a question. Otherwise, they'll say your gender thing.
Sir, I am extremely happy that you have come to Kolar. I welcome you, sir.
Thank you very much.
Sir, what are the key challenges you see in strengthening public health system?
Excellent question. Karnataka, I'm just giving you statistics. We have 2,500 primary health centers, 700 are excess. The doctor ratio in Karnataka should be 1:800 to 1:1000. We are at 1:405. We are going to reach 1:300, 350 very quickly. We do not require too many doctors. What we require are specialists and more super specialists. What is happening now in public health delivery system? Primary health care to a large extent, lower secondary health care is being taken care of. Higher secondary health care and tertiary care is where out-of-pocket expenditure is there. So under Ayushman Bharat Arogya Karnataka, or as madam was saying, certain places if you can give free or subsidized treatment, that is the way to go. Because 20% of people fall into poverty because of out-of-pocket expenditure due to health. So keeping this in mind, please increase your MCH, DM, DRNB seats. That is where the key is, not MBBS seats. Maybe cutting edge specialist seats like radiology or some other things. I would say even in nursing, neuro nursing, cardio nursing, or onco nursing. This is where the key is. I was talking to madam, as time goes, you know what's a total fertility rate, right? 2.1 is the replacement rate. That is, for every husband-wife, they will have 2 children. They get married and you have place. Why that 0.1%? Abortions, loss, etc. Karnataka is at 1.8, Kolar will be at 1.5. That means for every 4 men, 4 women, you are going to have only 6 to 7 children. So your population is going to go down. You may say, sir, this is all theory. Are you actually serious? Every year, 1 lakh less children are being born in Karnataka. Every year, 1 lakh less children are being born in Karnataka. As time goes by, it's not about deliveries which will be more important. It is infertility also. So you need to look at further what we do. So this is something which I would be requesting R.L. Jalappa Institute, Madam Engama, and all of you to keep. Keep your vision. You are a forward-looking district. I've been coming to Kolar since the last 15 years. You are a forward-looking district. Find solutions, find ways that after 5 years, when you look, you would have grown. Today what I decided is giving me results then. So this is a drishtikona you need to have. Anybody else? Nothing from the students? Usually students ask me very dicey questions. Yeah, madam. Yeah, madam. Please.
A very good afternoon, sir.
Good afternoon, madam.
I would like to know what measures are being taken to make government health schemes more effective at the ground level, sir.
Okay, good. See, the thing is, what is at the ground level? We have our A&M sub-centers, we have our primary health centers. This is the line where actual cutting edge is there. Are we filling up sufficient number of A&M posts? This is one, either on contract or on permanent. Second, many people don't want to be hospitalized. They are ready to come and go. So are we able to give them lab test, free lab testing? This is the second key. Third is preventive. Preventive is again NCD care, immunization care. These are the three main things. And I believe as far as obstetric care is there, it has to be a hospital-based delivery system. So you catch women faster who require treatment, treat them well. So whether you give iron sucrose or FC or anything, that is one vertical. Immunization is the second vertical. NCD vertical, the more you push through investigations, etc., you get better lifestyle disease-related approaches at the ground level.
Thank you.
Madam. And whatever I am speaking is actually what we are doing. I'm not talking in the air.
Good morning, sir.
Morning, madam.
Sir, in spite of qualifying your MCH and DM, what made you choose civil services?
Good question. I was wondering why did this come down. Okay. I was All India 14, I was in AIMS 13, PGI 6. I wrote the MCH. By the time these results came, both I wrote DM and MCH. I attended the interview, both I qualified. I actually worked in NIMANS for about 2-3 weeks. Okay. Then I realized, was that thing which I want to do throughout my life? It's a very conscious call I had to take. I decided otherwise. Because in a neurosurgical thing, madam will watch for that. It's 24 into 7 into 7 into 365 days. That's not my strength. My strength is very clear. I read daily, even now, 3 to 4 hours a day, other than my normal work. And I bring a lot of reading into actual applicative practice. I'm good at administration, madam. From 9 to 8, I can work. But after that, time is mine. So you have to prioritize in life. Whether you want to be a cricketer, you want to be a footballer, or you want to be an administrator or a doctor. So that's your value judgment. Value judgment. Yeah.
I am Dr. Borappa.
Yes, Dr. Borappa.
Harbor Medical Superintendent here. Since you are in charge of physical textures, you are in charge of fiscal
reforms.
Fiscal reforms.
Fiscal reforms.
Sorry. Many rural hospitals in the rural area require a lot of infrastructure.
No, you are mixing this up. I'm in the finance department.
Is it so?
Fiscal reforms and physical are two different words.
They are two different
Fiscal is to do with finance, physical is to do with structure.
I don't know whether you can convey this to the
in fact, there is a lot of, under the National Health Mission, under our thing, either repair or replacement. We call them Namma clinics are being enhanced. Health and wellness care centers are being enhanced. But frankly, as time goes by, we need to reduce the number of our physical structures. There are not so many patients. We need to consolidate places. P&SM people will tell you, one PHC for 25 to 30,000, right? In Karnataka, we are having PHCs for 7,000 people, 10,000 people. It's a waste of resources. You bring places which are previously connected, ill-connected well, then you will have better. Strengthen your taluka hospitals, strengthen your district hospitals, put tertiary care. You serve people better. See, previously you did not have connecting roads well. Now you have. Any place to any place is half an hour. So you have to look at it in a very dynamic sense. The gentleman's there. Professor of Emergency Medicine. Okay, this is a specialty which is very critical these days.
At the outset, I would like to thank Government of Karnataka for restarting the first 24 hours to 48 hours scheme for the preventing road traffic accidents.
Yes, the
and
Harish
scheme. sir.
Harish scheme, very, very
It has
important. And very
hugely
important for
benefited my patients and the patient care in the rural part, especially I being an highway hospital. At an outset, we see at least 45 to 50 trauma patients every day. Venkatramana sir sees every day we have at least 3 to 4 neurosurgery cases with the scheme.
Yes.
I have worked with 3 or 4 medical colleges and I am very happy to say we do the highest scheme patients in Karnataka. And
No,
we do.
it's not a very happy thing for me as an administrator because my highways are not safe. You may be
Yes,
happy
sir.
doing it, highways are not safe.
No, we are delivering patient care, sir.
Yeah, yeah.
And I would like to also ask you that over a period of time, last 10 years, last decade, the cost of living has increased, but the scheme allowance or amount sanctioned for any particular case is really very less.
I'll tell you why. I'll tell you two things. First, I would like to add your name, sir.
Dr. Rajesh, sir.
Dr. Rajesh, just this. We have the Government of India scheme, we have the Government of Karnataka scheme. We have merged both. In the country, in the accident thing, now we give about 1.5 to 2 lakhs. The Government of India scheme was giving, I think, just about 50,000. We have added 1.5 lakhs, it's 2 lakhs. So this is one of the highest accident reimbursement scheme in the country, nowhere it is. Second, you are talking of Ayushman Bharat Arogya Karnataka. We did a costing for that. There are certain number of procedures, and then we have added new procedures, new rates. Presently, we spend 1,800 crores, 500 crores Government of India gives, 1,300 crores I match. If I take his suggestion and do it, as per 2022 rates, it is going to cost me 1,000 crores extra. If I do 2025 rates, it is going to cost me 1,500 crores extra. It's a very conscious decision I have to take. I don't mind taking it, but then what sir asked me, what others asked me, Professor Hanmantra asked me, sir, what are you doing about medicines at other places? What are you doing for treatment at other places? Will get compromised. Because that 1,500 crores is a significant amount. So in public administration, my pie is so much, I cannot enlarge. Whatever pie I have to prioritize and give.
Sir, like any other scheme which Government of Karnataka is giving free rice and things, I would request
I
you
will
to,
not
you
talk
would,
on
I would
that.
request
I
you
will
as a citizen, as a doctor, to do something to my patient with something really.
We will do
innovative.
this discussion offline. I'll tell you. I can't tell everything online. That's why we are bureaucrats
Yes, sir.
also.
So here I have one question, sir. Here.
Yes, sir.
Yeah, I am professor
Please,
of.
I would request the chair. Tell me, sir, please stop, come back, I'll come back.
Sorry, I am Dr. Rajshekar, professor of dermatology. Sir, I have only one question. Actually, in dermatology, we have good number of autoimmune and other
Why are they not
systemic.
covered under Ayushman Bharat Arogya
Yes, sir. The biological treatment and cytotoxic drugs we give a lot, but that
We-
is not
we will-
included in the various schemes in the government.
Discuss this offline. I'll tell you why.
Sir,
I'll
and
tell you.
other states like Tamil Nadu, they have given, sir, for dermatology.
I promised I'll talk to you offline.
Sure,
Give
sir.
me
Sure,
time
sir.
on that.
Thank you, sir.
Yes, sir.
Sir, I'm Dr. Prabhakar, sir. Principal. Yes, sir.
Prabhakar
Sir,
sir.
yes, sir. Whenever the budget announced, sir, whenever budget announced, there's always complaint regarding the public health care often receives low budget priority compared to the defense, infrastructure, and other sectors.
I can't hear you, sir.
So there's one important complaint, sir. Whenever the budget announced, the health and education receives less priority compared to the defense and other infrastructure.
Yes.
That's that compared to other countries, especially the developed countries and all.
Yes.
What is your opinion?
No. Here's a good question. He says, sir, when the government of India runs its budget, you are giving less money to health and education than to giving it for defense. First thing, defense is union government's mandate. It has to do it. Health and education are government of Karnataka mandate. It is state mandate constitutionally. So we have to do it. They can do support, but primarily it is our role. First. Second, even in defense, maximum amount of budget is for salaries and pensions. Please see that. Even in our thing, healthcare, etc., it is salaries and pension to this. The absorption capacity in the health department, education department, other than salaries and this one is very less. For example, we have to buy, I am 550 tenders we have to float in a year. To finish this 550 tenders, it takes 2 years to float. Because our processes and procedures, transparency, accountability becomes very critical. You as an organization, Dr. Manjunath, as a procurement, he can Directly negotiate with 4 of you, decide, tell your management. I can't do that. If technically I go wrong, minor thing, I have to recall. So that's again 3 months gone. So the procedures differ from you and me. Second, Government of India has a different mandate. Our mandate is different. Yeah.
Sir, I'm Dr. Azim, former medical student
Yes.
and ENT HOD and head and neck surgeon. I've been a special forces officer. Like, I have just 2 small things.
Please, please.
One, we are talking of technology, imbibing technology. Embedded technology, okay?
In
progress.
In progress,
We
okay.
have far off places with hardly any medical facilities.
Right.
Which you really cannot.
Where?
In peripheral areas, for example, northern Karnataka, few districts, the border districts of Karnataka. So, I'm just suggesting why we have technology, we are putting so many satellites in one go in orbit. Why not adopt telemedicine from and have coordination with state-of-art hospitals or at least teaching hospitals on a regular basis?
Okay. Just first question I'll do. Already telemedicine is in place. It's been talked of since the last 20-25 years. It has its limitations, it has its advantages. There is an ecosystem for it. It is happening. It will not replace traditional healthcare delivery. It can support in a few things. It is an ongoing thing. This is my first answer. What is your second question?
My second question is, like, I was very happy when you mentioned higher medical care
Yes,
to be
tertiary.
prioritized.
Tertiary.
There are lot of hospitals, tertiary care hospitals without facilities of higher care. For example, radiation oncology or laser.
So
laser.
what's your question?
Why not provide at least at district hospital level?
I think it's
a
a
laser
brilliant
machine?
question. I think it's a brilliant question. We have costed it. It is going to cost us to put 18 super specialities in every medical college in Karnataka for all 350 crores per specialty plus running cost of 60 crores. It is going to cost me 8,617 crores. We have done the homework on that. The only issue on this is, can we do it immediately or we'll do it over 5 years? If you and I meet each other after 5 years, we would have traveled 60-70% of this route.
Sure.
Believe me, we will do it.
Definitely.
Okay, I will now talk to
Thank you,
some
sir.
of the students, please. The faculties, okay? Some of the 2 students, then I stop because they will have others to speak. Yeah, some students, please. A lady and a gentleman, huh? So gentleman has his lucky, the lady is next.
Sir, good morning.
Namaskar.
I am Tarun.
Tarun.
Sir, ಇವಾಗ ಕಾರ್ಡಿಯಾಕ್ ಅಟ್ಯಾಕ್ ಜಾಸ್ತಿ ಇದೆ ಇನ್ ರೂರಲ್ ಏರಿಯಾಸ್ ಎಲ್ಲ. ಅದ್ರಿಗೆ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ ಒಂದು ಸಪರೇಟ್ ಸೆಂಟರ್ ಮಾಡ್ಬೋದಲ್ಲ? ಇವಾಗ ಎಕ್ಸಾಂಪಲ್ ಪ್ರೈವೇಟೈಸ್ ಅಲ್ಲಿ
STEMI program is exactly that. ಒಂದೇ ಒಂದು ಹುಷಾರಾಗಿರ್ರಿ. STEMI program can go up to the district level or maybe when you have a physician up to the taluka level. There is something called the STEMI scheme. We call it the APPU scheme also. You are not aware of this? The problem is all of you are on WhatsApp. You don't read newspapers. Can't resist it, you know.
Not
this.
like that, but this is we can make like a private sector. In private sector there is a Narayana Heart Center.
Correct.
Like that we can make in a government sector for the every district of Karnataka.
It is there. It is there. It is an incremental thing. It is there. The district hospital comes under the health department, which basically comes up to the MD general medicine level. We are putting medical colleges in each and every place for intervention. The district health hospital or the taluka hospital can take care of acute MI without intervention, which I mean is angioplasties or angiograms. Other than that, we are in a position to do, that's what I was mentioning, in about 5 to 8 years from now, we will saturate every district from the government for cardiology, cardiothoracic surgery. We are aware of this. We are completely aware of this. Yeah, that lady there in yellow. That's what I also know.
Sir, good afternoon, sir. I'm Dr. Anjani, second year postgraduate from Department of Orthopedics. First of all, thanks for your insightful talk, sir. My question is, how do young doctors contribute beyond the hospitals to build a stronger healthcare ecosystem?
Okay, this is very interesting. As a private practitioner, you can do what you want. In a government setup, you have your duties to a certain level, but in government setup, you have a lot of administrative duties which will actually add to the health sector. Third is the role I am doing, where I'm a pure administrator. I understand you, I understand the administrative systems, and I put it into practice. So in each one of you need to find what you are good at, do that well. If you have time to do other things, associate with NGOs, associate with the government, and try to push. Madam was telling me that she was talking to a couple of IAS officers in Andhra, etc., where she was able to get things done. You have to find, first do what you do well, then find time and try to associate with others and do. Slowly you become an important resource. Please do not be under the assumption only you can do, or only I can do, or only somebody can do. It's only when we all do it together, we do it well. Thank you very much.
Thank you so much, sir. I now request Dr. T.D. Power, HR Manager, SDUAHER, to introduce our guest of honor, Dr. R.N. Srinathan, sir. Over to you, sir.
Good morning to all, the dignitaries on and off the days, and all the invitees, press and media friends. On this auspicious occasion, today, it gives me an immense pleasure to introduce one of the chief guests, Dr. R.N. Srinathan. Sir is an retired dean, a professor, and a chair of Anatomy of Neuroscience, St. Matthew's University School of Medicine, and AI American School of Medicine, Grand Cayman, Jamaica, West Indies. In fact, Dr. R.N. Srinathan, sir, doesn't require any introduction, as he is known and highly revered in the field of anatomy in particular, and in the entire medical fraternity in general. But in a nutshell, I am going to introduce him with his academic excellence in anatomy, social service as a generous personality. Such are the multidimensional personality of Dr. R.N. Sitaram, sir. And it is very difficult to imagine or cover the scale of what Dr. R.N. Srinathan, sir, has accomplished, both as a scholarly built-up personality and an authority in anatomy and a knowledge over the metaphysical world. His academic leadership. Sir was former academic director, Chinmaya International Foundation, Kerala. He is honorary professor of Gita and Science at International Hindu University, Miami, United States, and he is currently guiding a PhD students on science in the Gita. His academic and teaching excellence are, Sir has served as a professor of anatomy for 43 years, teaching in medicine, medical colleges all over the world. He has been awarded PhD with distinction from Banaras Hindu University for his pioneering and outstanding research on fetal alcohol syndrome. He has authored 20 international publications for his credit and guided numerous postgraduate scholars. He was honored with 5 times with the Golden Apple Award as a best teacher by the American Medical Students Association. His scientific and professional recognitions are, he has received the Henry Gray Award as Anatomist of the Year at the World Congress of Anatomy in 2017, presented by the Honorable Chief Minister of Karnataka, Sri Siddaramaiah. His spiritual contributions and publications are, he is the editor of Chinmaya Jyoti Chinmaya Mission's official spiritual magazine at Hyderabad. He has translated Gita Makaranda into Kannada, and its proceeds are being donated to an old age home in Bengaluru. He is the author of Om, I Am a Novel Journey into Vedic Legacy, a globally published spiritual novel, and Bhagavad Gita in the lens of neuroscience, Own Your Happiness, forthcoming, released by Motilal Banarasidas, Delhi. His service and outreach are that he has served as chairman Chinmaya Vidyalaya at Begumpet in Hyderabad. He delivers daily lectures on the Bhagavad Gita at Advait Retirement Homes, Medchal in Hyderabad. He has received eminent educational award by the International Institute of Education and Management in 2012. So, Dr. R.N. Srinathan sir, the excellence in the field of medical research, especially in anatomy and social, that's in service, and scholarly built-up personality and an authority over the knowledge of metaphysical world. Sir, once again, I heartily welcome you to this August function, and I am grateful to the organizers of this, the August functions for having given me an opportunity to introduce the one of the guests to these day's functions. Thank you, one and all.
Thank you, sir. I request our guest of honor, Dr. R.N. Srinathan, sir, retired Dean, Professor, and Chair of Anatomy and Neurosciences, to share a few words on the special day. Over to you, sir.
Elrigu namaskara. ಸ್ವಲ್ಪ I deviate from the routine. It's been routine, so instead of individually naming everyone, ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. I save time, quite a lot of time out of that. And now, what to speak, Dr. Vishal identified a beautiful mechanism of question and answer. But my point is little beyond that, beyond life. Because I have completed almost life. It's nearing 80 years. So now I am looking beyond. So there is life even to look beyond also. So what is that? How is that? You may be surprised to know where you are sitting now. It is here I used to move about in 1990, where there were about 5 rickety steel almirahs with Gray's Anatomy, old edition, Cunningham volumes, Chatterjee Physiology, and some Chatterjee Anatomy, and Chatterjee, some other books used to be there. So one day, I requested Mr. Jalappa ji, sir, let us have some new books. ఏమయ్యా అదేమి నువ్వే పోయి కొన్ని తీసుకురా. So I went to Bangalore. So I don't want to name the person. I told him I want to buy the books. I have got a green signal from college. So I will buy the books. He told, okay, sir, sit down. After some time, he got an envelope. He gave me, sir, you take this and go. You don't do anything. You keep signing. That is enough. I didn't know what he is telling. When I opened, there was 1 lakh rupees in that. Then I was shocked. I didn't talk to him. Coolly, I came back. I told the same thing to him. Then he told, ilagunda. So we will do one thing. Where do you get the books? Bombay we will get. So we will book a ticket to Bombay. Both me and you will go to Bombay. So both of us went to Bombay for about 4 days. The book which he was selling for 500 rupees, we got for 30 rupees. So some 2 loads of books we ordered from there. That is how the library here developed. So he wanted me to continue here. But I told, sir, I have to go back. I am going abroad. I had come from abroad. I am going back. Then he told, you are going back. Don't go anywhere, you be with me. And then one day he called me, there was a guest house near a hospital somewhere here. And he called me and he told, "Ee dabbu petko. No, you be here." I opened and saw there was 1 lakh rupees. There was nothing, no reason he had to give me. He gave me 1 lakh and he told, you be here with me. Then somehow I could not stay for some other reason. So I finally told him I will go for 6 months and come back. He agreed. I went for 6 months, and then after 6 months I asked my co-son-in-law to send money back to him. When he sent him money, he telephoned him and told, no, nak dabbuloddu. He has to come back. And so somehow I apprised him, I returned his money, and we remained good friends. That was my relationship with Jalappa ji. That was how I was connected to this college. It's a beautiful journey from there. I went abroad. I grew in my own way. But finally, what is interesting is I grew spiritually. What is that spiritual growth? It is something which cannot be told, but I want you to taste it before I sit. The tasting is very simple. Heraclitus told thousands of years back, you cannot step into the same water second time. Do you know that? There is a river flowing. You put your foot down in the river, lift it up. You cannot put your foot down into the same river second time. The second time, water has flowed down. That is how I say in one of my TED talk I have told you, you can check in YouTube, I have told, you cannot give shake hand to the other person second time. You shake hand, again try to touch his hand, it is not the same person. You are not the same person. All your cells have changed. Do you know when you touch the cells, some cells of the skin were there on the surface, by the time you touch, those cells have gone. Because every cell in the body is constantly rotating. 1 month, your cells of the skin are completely replaced. And I tell you, if you are 70 years old, at least you are 10th body you are holding. Every 7 years, your body changes. It's not the same body what you are holding. But you think you are the same person. That is the illusion. Then who is real? And you say, for example, I am very happy. Where is that happiness? You get objects from, getting objects from Amazon. I am so happy by getting it. But you know, dopamine must be released in nucleus accumbens. There is a nucleus in the brain. A dopamine should be released there. Unless dopamine, some picograms of dopamine is released there, you don't feel the joy. So whether the joy is in object or is in your dopamine released, is it in your neuron, is it in electrical activity, where is it? But you have happiness. Who is it? You. I have happiness. I have a good body. Who is this I? My mind is not good now today. Who is this I? If you know who is this I, you are out of the problem. And you know then what? You enjoy life. You start enjoying life better because we have closely, blindly identified with the body which is constantly changing. It is a energy which is constantly changing. So who am I? Just I tell this and stop. If you have any question, you can ask me later. I can share with Dr. Manjunath. He was my good student in 1978 in KMC, and he has been in touch with me since then. Many of here, Mr. Krishnappa, Dr. Krishnappa, yeah, he was my student. It's all very good. All these were. And what a nice thing to have your own people here. And that is what a teacher gets. A teacher will not get anything, but when his students grow, he gets satisfied. Because the seed what he had sown has grown into a tree. That is the best thing that can happen to any person. So now, who are you? I will answer this question. This, who are you, is after you. When you are thinking, it is behind thinking. When you are walking, it is behind walking. When you are seeing, it is behind seeing. It is awareness. It is consciousness. You are alive. You know I am alive. I am there. I have life. This I alone is real. This I is not sleeping when you sleep. It is silently observing your sleep. That is why you enjoy and you say after waking up, I enjoyed my sleep. It is this I which never dies. So identify with this I which never dies. From the I which constantly dies. Wrongly we have identified with the I of the body which dies every day, every moment, every second. Instead of that, shift your identification to consciousness. You unplug from this unwanted thing and plug it to consciousness. Be free, be happy. Thank you for inviting me.
Thank you so much, sir. It's time to honor and express our gratitude. We now felicitate our chief guest and guest of honor for gracing this occasion. Thank you, everyone. I now request Dr. Lakshmaya, former Medical Superintendent, RL Jalappa Hospital and Research Center, to please address the gathering. It'll get better.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರಗಳು. Dignitaries on the dais, of the dais. I am very proud that I've been called to speak a few words about my association with Sri R.L. Jalappa. He is a person of great personality, a man of courage, commitment, and if he takes up some work, he never leaves. It has to happen. And I am from this place, Kolar. I'm very fortunate that Jalappa has started this medical institution, and I've been associated with this from day one. And when I got appointed in 1987, I had to wait for another 6 months before I could join this institution, because I was a clinician. So the preclinical subjects were started. So after 6 months, I had to start my career as a teacher here. And I had very good times, bad times. So everything I have witnessed, good, bad, and ugly with Mr. Jalappa ji. I was into the institution, I was out of the institution. I came back. Then I was a medical superintendent. Then he asked me to resign. I resigned. Then he asked me to come back again. I came back. Again, third time, I had to become medical superintendent. So this was a very fantastic relationship that I had. Many times I fought with him for the betterment of the institution. I have acted against his wish. In his own presence here, I have taken decisions as a medical superintendent in the interest of the hospital against his wish. So, and I just take few minutes to narrate that instance. One medical research work was going on in the university, and everybody was busy. VC was busy, then that Chandrapa, then administrative officer, he was also busy, and our hospital faced some problem of strike. All the staff, the nursing, then Group D, technicians, drivers, everybody went on strike. And they all sat in the podium of the hospital saying that will not work. Then I had some sick patients in the ICU. And I thought I may lose some patients without proper nursing care, technical support, and in the meantime, there was a patient who had to be shifted to Nimans. And there was another delivery patient who was to be taken for cesarean. There are no nurses. They're on strike. And we requested the nursing college to help us. They came and saw in the OT. They could not find anything. Where are the instruments? Where is the linen? Where is the sterile gowns? They could not find anything. So this is a very tricky situation that I had to face. Then Mr. Jalappa came in the morning and he addressed the gathering. And before he came, I told him, sir, they are not cooperating. They are very angry. So we'll have to be very nice and talk to them nicely. Then he said, no, don't worry, I'll come and talk to them. He came and addressed them. Then he said, whatever increments you are supposed to give, we'll give it. You all please disperse. Then one among them got up and said, sir, please give it in writing. Then only we'll get up and start working. Then he lost his composure, got angry, and he said, nothing doing. My words are in writing. There's no need to give in writing. My words are the one which will happen. Then finally, they did not stop the strike. It went on. Then he came to my chamber, sat there, had some tea, and he instructed me, Lakshmana, don't go there. They're very arrogant. Don't talk to them. Don't request them. He instructed and left. He was in the guest house. Then around 3:30, the labor officer of the Kolar town came and said, sir, it's going to be very bad. Better we take a decision and stop this strike. Then I knew hospital is going to be in trouble. If there are any deaths, the entire institution will get bad name. Then around 3:30, I gave a letter saying that as per the decision of the management, the increment will be given to all, and you all call off your strike and get back to the work. Then they issued that letter and they stopped the strike and hospital came to normal work. So I was relieved that everything was going on well, no deaths, no problem in the hospital. Then around 5 o'clock, Mr. Jalappa visited the hospital again, came to my chamber and asked, what happened to the strike? So nothing, sir, they all started working, no problem. Everything is normal. How did it happen? Sir, you said you're going to give increment. So same thing, I gave it in writing. Then he scolded me. No, you should not have done that. That is not the way of doing it. You went against my words. You spoiled my stature. Then I told him, nothing, sir. I have not spoiled anybody's stature. In the interest of the institution, I had to take this decision. Whatever you said, I given it in writing, and I am happy that the hospital is working well. Everybody are happy, they are working. There is no problem. If I had not given the letter, I would now got into more problem. You yourself would have got a bad name. So with that, it ended. So like this, many occasions I had to argue with him for the betterment of the hospital, betterment of the institution, and he was always very nice to me. So I was his personal physician for many decades. Whenever he used to be ill, he had some wheezing problem, diabetes. So I used to be the first person to take care of him. When he had MI, so I had to give the streptokinase, and Dr. Prabhakar happened to administer that in his nursing home. I also had a nursing home much before the hospital was started. So with this, the great personality of Mr. Jalappa, we have lost him, but whatever initiatives that he has taken, developed the institution, which has given so much of opportunity for the people here for better health care and health education, nursing education. We are really proud of him, and we are very, very fortunate that he came all the way from Chikbalapur, Dodbalapur, and started this institution here in Kolar for the benefit of our people here. I worked for 30 years in this institution. Though I had a private practice of my own nursing home, still I am having it. So I could associate it with the institution for 30 years and see that we could give better care to the population around this institution. Thank you all for patient hearing.
Thank you, sir. We request everyone to please be seated in the auditorium. Do not leave the hall in between. I now request Dr. Borappa, sir, the former Medical Superintendent, RLJH and RC, to address the gathering. Over to you, sir.
ನಾನು ಇದನ್ನು ನಿರೀಕ್ಷಿಸಿರಲಿಲ್ಲ. ತುಂಬ ದಿವಸಗಳಾಯಿತು ಬರಬೇಕು ಅಂತ ಬಂದೆ. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಸಭಿಕರಿಗೆ, ವೇದಿಕೆ ಮೇಲಿರೋರಿಗೆ. ಡಾಕ್ಟರ್ ಶ್ರೀನಾಥ್ ಅವರು ಒಳ್ಳೆಯ ಒಂದು ಬೇಸನ್ನು ಹಾಕಿಕೊಟ್ರು ನಮಗೆ ಮಾತಾಡೋದ್ರಲ್ಲಿ. ಜಾಲಪ್ನವರ ನನ್ನ ಸಂಬಂಧ ಸುಮಾರು ಈ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬರೋದಕ್ಕೆ ಮುಂಚೆ 10-12 ವರ್ಷಗಳ ಹಿಂದಿನ ಒಂದು ಇದು. ಎಷ್ಟೋ ವಿಷಯಗಳಲ್ಲಿ ಅನೇಕ ಬಾರಿ ಅವರ ಮನೆಗೆ ಹೋಗ್ತಿದ್ದೆ. ವೆರಿ ಗುಡ್ ಆತಿಥ್ಯ ತುಂಬ ಅವ್ರದ್ದು. ಪಕ್ಕದಲ್ಲಿ ಬಂದು ಕೂರೋರು. ಬೆಳಗ್ಗೆನ ಬ್ರೇಕ್ಫಾಸ್ಟ್ ಭಾಳ ರಿಚ್ ಆಗಿರ್ತಿತ್ತು. ಅದರ ವಿವರಣೆ ನಾನು ಕೊಡಲಿಕ್ಕೆ ಹೋಗಲ್ಲ. ಈವನ್ ನಾನು ಗೆಸ್ಟ್ ಹೌಸಲ್ಲಿ ಇಲ್ಲಿ ಕೋಲಾರಲ್ಲಿ ಇರುವಾಗ ಗೆಸ್ಟ್ ಹೌಸಿಗೆ 8:30 ತಿಂಡಿ ತಿನ್ನಲಿಕ್ಕೆ ಹೋದರೆ ಪಕ್ಕದಲ್ಲಿ ಬಂದು ಕೂತ್ಕೊಳ್ಳೋರು. ತಗೊಬಂದು ಹಾಕೋ, ತಿನ್ನಿರಿ, ಚೆನ್ನಾಗಿ ತಿನ್ನಿರಿ ಅನ್ನೋರು. ಅಂಥ ಒಂದು ಆತಿಥ್ಯ ಅವರ, ಅದನ್ನು ನಾನು ಮರೀಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. 1999 ಡಿಸೆಂಬರ್ 6ನೇ ತಾರೀಕು ನಾನು ಇಲ್ಲಿಗೆ ಬಂದೆ. ಕೇರಳದಲ್ಲಿದ್ದೆ ನಾನು. ವಾಲಂಟ್ರಿ ರಿಟೈರ್ಮೆಂಟ್ 20 ವರ್ಷ ಆದಮೇಲೆ KC ಜನರಲ್ ಆಸ್ಪತ್ರೆಯಿಂದ ನಾನು ವಾಲಂಟ್ರಿ ರಿಟೈರ್ಮೆಂಟ್ ತಗೊಂಡ್ಬಿಟ್ಟು ಕೇರಳದಲ್ಲಿದ್ದೆ. 4 ವರ್ಷ 6 ತಿಂಗಳು 7 ತಿಂಗಳು ಇವರು ಇಲ್ಲಿಂದ ಪದೇ ಪದೇ ಫೋನ್ ಮಾಡಲಿಕ್ಕೆ ನನಗೆ ಶುರು ಮಾಡಿದರು. ಬನ್ನಿ, ನನಗೆ ಮೆಡಿಕಲ್ ಸೂಪರ್ಡೆಂಟ್ ಬೇಕು, ಮೆಡಿಕಲ್ ಸೂಪರ್ಡೆಂಟ್ ಬೇಕು ಅಂತ ಹೇಳಿಬಿಟ್ಟು. ಕೊನೆಗೆ ಬಂದೆ. ಹಾಸ್ಪಿಟಲ್ ತೋರಿಸಿದ್ರು. ಏನಂತೀರಿ, ಬರ್ತೀನಿ. ನನ್ನ ಒಂದೇ ಕಂಡೀಷನ್ನು, ನಾನು ಐ ಹ್ಯಾವ್ ಗಾಟ್ ಮೈ ಆ್ಯಕ್ಟಿವ್ ಸರ್ಜಿಕಲ್ ಲೈಫ್. ನಾನು ಸರ್ಜರಿ ಇಲ್ಲದೆ ನನಗೆ ಪ್ರೊಫೆಷನ್ನು ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ ಆಗಿರಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ನನಗೆ ಸರ್ಜರಿಗೆ ಅವಕಾಶ ನೀವು ಮಾಡಿಕೊಟ್ರೆ ಮಾತ್ರ ನಾನು ನಿಮ್ಮ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬರ್ತೀನಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಇವಾಗ ನನಗೆ ಒಂದು ಯೂನಿಟನ್ನು ಕೊಟ್ಟರು. ಡಾಕ್ಟರ್ ಶೇಷಾದ್ರಿ, an elderly person, was holding that unit, and I was given that unit to me, and Dr. Madan and Dr. Ramesh Reddy were the assistant professors. They were my assistants. We did a good job. That was it. ನಾನು ಬಂದು ಹಾಸ್ಪಿಟ್ಲಿನ ಇನ್ಚಾರ್ಜ್ ತಗೊಂಡಾಗ ಇಟ್ ವಾಸ್ ಪೇಷಂಟ್ ನಂಬರ್ ವರ್ ವೆರಿ ಲೆಸ್. ಆಮೇಲೆ ನಿರಂತರ ಪ್ರಯತ್ನ, ಭಾಳ ಕಷ್ಟಗಳು. ಆಮೇಲೆ ಹಾಸ್ಪಿಟಲ್ ವಾಸ್ ಗ್ರೌಂಡ್ ಫ್ಲೋರ್ ಆ್ಯಂಡ್ ಫಸ್ಟ್ ಫ್ಲೋರ್. ನಾನೊಂದು ಸರಿ ಜಾಲಪ್ನವರಿಗೆ ಕೇಳಿದೆ, SNR ಹಾಸ್ಪಿಟಲ್ ಫೆಸಿಲಿಟೀಸ್ ಇತ್ತು, ಇನ್ನು ಎಷ್ಟು ವರ್ಷದ ತನಕ ಇದೆ? 2007 ತನಕ ಅಂತಂದರು. ಸರ್, ಹಾಗಿದ್ದರೆ ನಮಗೆ ಹಾಸ್ಪಿಟಲ್ ನಾವು ಬಿಲ್ಡಿಂಗ್ ಕಟ್ಟಬೇಕಾಗ್ತದೆ, ಈಗಲಿಂದನೇ ಪ್ಲೀಸ್ ಸ್ಟಾರ್ಟ್ ದಟ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಆವಾಗ ಅಡಿಷನಲ್ 2 ಫ್ಲೋರ್ಸ್ ದೇ ಸ್ಟಾರ್ಟೆಡ್. ಹೀಗೆ ನಿರಂತರವಾಗಿ ಹಾಸ್ಪಿಟಲ್ನ ಡೆವಲಪ್. ಲಕ್ಷ್ಮಣರು ಹೇಳಿದರು, ಕೆಲವು ಘಟನೆಗಳನ್ನ ಹೇಳಿದರು. ನಾನು ಸಾಕಷ್ಟು ಘಟನೆಗಳನ್ನ ಇಲ್ಲಿ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಫೇಸ್ ಮಾಡಿದ್ದೀನಿ. Attacking the hospital for hospital's patients' death or any other incidents. There were times when I spent complete nights in the hospital with the reserve police in the hospital compound. ಮಧ್ಯರಾತ್ರಿ ಕಳೆದ ಮೇಲೆ ಇನ್ಸ್ಪೆಕ್ಟರ್ ಹೇಳಿದರು, ಸರ್ ನೀವು ಯಾಕೆ ಇಷ್ಟೊತ್ತಿರ್ತೀರಿ, ನಾವು ಇದ್ದೀರಿ, ನೀವು ಹೋಗಿ ರೆಸ್ಟ್ ತಗೊಳ್ಳಿ ನೀವು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. Those were the times. And there was one time there was a ಒಡಗೂರಲ್ಲಿ ಒಂದು ಫೈರಿಂಗ್ ಇನ್ಸಿಡೆಂಟ್ ಆಯಿತು. One patient was brought dead morning, and another was bleeding through the chest and throat. ನಾನು ಸ್ನಾನ ಮಾಡಿ ಈಚೆಗೆ ಬಂದೆ. ಕರೆದ್ರು, ಸರ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಈಗ ಬಂದಿದೆ, ತಕ್ಷಣ ವೆಹಿಕಲ್ ತಗೊಂಬಾರಪ್ಪ ಬರ್ತೀನಿ ಅಂತ ಬಂದೆ. ಒನ್ ಆಫ್ ದಿ ಪರ್ಸನ್ ಡೆತ್, ಹುಡುಗರು ನಾಗರಾಜ್ ಅಂತ ಅವರು ಪಕ್ಕದಲ್ಲಿ ನಿಂತಿದ್ದರು. ಅವರ ಬ್ರದರ್ ವಾಸ್ ಡೆಡ್ ಬಾಡಿ ವಾಸ್ ದೇರ್. Another person was bleeding through the throat. I immediately told, call up the nurse, OT and then anesthetic. Be prepared to intubate him, and I am bringing him to OT. OT shift ಮಾಡಿ intubate ಮಾಡಿ. Then we told the blood bank. ಆಮೇಲೆ number of units of blood was given. This boy was saved. He was in the ICU. ಕೆಲವು ಇನ್ಸಿಡೆಂಟ್ನ ನಾನು ಇಲ್ಲಿ ಹೇಳಲೇಬೇಕಾಗ್ತದೆ. ಪ್ರಾಬಲಿ this will help the young students and the young doctors to know what are the circumstances which they may face. That day was Saturday. Friday this happened. Saturday I was there. Sunday I went home. ನಾನು ಊಟ ಮಾಡ್ಕೊಂಡು ಬರ್ತೀನಿ ವಾಪಸ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು, ಬಿಕಾಸ್ ಆಫ್ ದಿ ಸಿಚುಯೇಷನ್ ಆಫ್ ಸೋ ಕಮೋಸ್. ಹೋಗಿ ಬಂದು ಊಟ ಮಾಡ್ಕೊಂಡು ಬಂದೆ, ಸೀದಾ ICUಗೆ ಹೋದೆ. Dr. Bharat was the intensivist. Now he is not here. I went and saw the patient. He said, sir, this one saturation is going down, patient breathing is not breathing. I took the stethoscope, auscultated, no breath sounds. Then I told him, he was an intensivist, believe me, because these are the things the young doctors should know. Then I told him, Bharat, please take out the endotracheal tube. He took out the endotracheal tube, complete, it was blocked. Then he put the new endotracheal tube, patient became all right. If I were not to come at that time to ICU, somehow God has brought me, patient would have been dead. So these are some of the symptoms. However big you may be, however knowledgeable you may be, but at times you need cross consultations, help from other people. There are so many incidences in ICU also. Let me not go to those things. Jalapnara ನನ್ನ ಸಂಬಂಧ ಭಾಳ ವರ್ಷಗಳದ್ದು, ಭಾಳ ಆತ್ಮೀಯತೆ ಅವರಲ್ಲಿತ್ತು. ಇಲ್ಲಿಗೆ ನಾನು ಮೆಡಿಕಲ್ ಸೂಪರಿಂಟೆಂಡಾಗಿ ಬಂದಾಗ ಸಾಕಷ್ಟು ಡೆವಲಪ್ಮೆಂಟ್ಗಳನ್ನ ಅವ್ರಿಗೆ ನಾನು ಹೇಳ್ತಿದ್ದೆ, ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಯು ನೀಡ್ ಟು ಸ್ಪೆಂಡ್ ಮನಿ, ಯು ನೀಡ್ ಟು ಇಂಪ್ರೂವ್ ದಿ ಹಾಸ್ಪಿಟಲ್. ನೀವು ಹಾಸ್ಪಿಟ್ಲಿಂದ ಇನ್ಕಮ್ ತೆಗೀರಿ, ಹಾಸ್ಪಿಟ್ಲಿಂದ ಇನ್ಕಮ್ ತೆಗೀರಿ ಅಂತ ನನಗೆ ಎಷ್ಟೋ ಸರ್ತಿ ಹೇಳೋರು. ಇಲ್ಲ, ಆಗೋದಿಲ್ಲ. This hospital is run because of the college. You have to substitute money from the college to run the hospital and improve the hospital. These were the arguments between me and him. There are so many times it used to happen. Jotege, there were many people, some of the bad people around here, who used to go and ಚಾಡಿ ಹೇಳೋದು ಜಾಲಪ್ಪನವರಿಗೆ, ಹಾಗಾಯಿತು ಹೀಗಾಯಿತು, ಅದು ನೋಡಲಿಲ್ಲ ಇದು ನೋಡಲಿಲ್ಲ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ಅಟ್ ಒನ್ ಅಕೇಶನ್ ನನ್ನ ಚೇಂಬರಿಗೆ ಬಂದರು, ಯಾರೋ ಒಬ್ಬರು ಹಿಂದಿನ ದಿವಸ ಚಾಡಿ ಹೇಳಿದ್ರು ಅವರಿಗೆ. ಒಂದು ಪೇಷಂಟ್ ಐ ಅಟೆಂಡೆಡ್, ICUಗೆ ಹಾಕಿ ಪಾಯ್ಸನ್ ಕೇಸು ಅಟೆಂಡ್ ಮಾಡಿಸಿ ಇದು ಮಾಡಿಸಿ ಡಾಕ್ಟ್ರಿಗೆಲ್ಲ ಹೇಳಿ ಹೋಗಿದೆ. ಮಾರನೇ ದಿವಸ ನಾನು ಚೇಂಬರ್ಲಿ ಕೂತಿದ್ದೆ, ಬಂದರು. ಏನಂತೆ ಹೀಗೆ ಹಾಗೆ ಏನೇನು ಸ್ವಲ್ಪ ಬಿಕಾಸ್ ಐ ಫೆಲ್ಟ್ ಬ್ಯಾಡ್. Though he was very good man, I felt bad. Then I told him, sir, if you are not happy with my administration, please relieve me today itself. I am ready to go. He just kept quiet for a minute. Then he ಹೇಳಿದ್ರೆ ಹೇಗೆ ಅಂದರು. ಆವಾಗ ಹೌದು ಸರ್, I did not request you for a job here. On your request I have come. So I am working to my satisfaction. If you are not happy, you can send me. So ಅಲ್ಲಿಗೆ ಅದು ಮುಗೀತು. ನಾವು we continued our relationships. But again, I tell you, he was very good at heart. He was a good host also. ಹಾಸ್ಪಿಟಲ್ ಡೆವಲಪ್ಮೆಂಟಿಗೆ ಸಾಕಷ್ಟು ಆಗಿದೆ. ಈಗ ಇಲ್ಲಿ ಮಾತಾಡಲಿಕ್ಕೆ ನಾನು ಪ್ರಿಪೇರ್ ಆಗಿ ಬಂದಿರಲಿಲ್ಲ, ಹಾಗಾಗಿ ನನಗೆ ಕೆಲವು ವಿಷಯಗಳು ನನಗೆ ಹೇಳಲಿಕ್ಕೆ ಇಲ್ಲಿ ಆಗ್ತಾ ಇಲ್ಲ. ಲಕ್ಷ್ಮೀನವರು ಕೆಲವರು ಹೇಳಿದರು. At times there were very bad times I faced in this hospital because of the mobs attacking whenever an incident happens, a death happens in this hospital. Here I remember one person, I don't know whether he has not come today, Dr. Govind Raju, who was in charge of blood bank. Later he was in charge of casualty. He was the person who stood with me, and the next person is none other than Dr. Lakshmanya. So these are the two persons who cannot forget, who stood with me at my difficult times in this hospital. I used to make night rounds. When I left this hospital, my successors and my other doctors told me, sir, you have set up a bad trend of night rounds to the unit doctors and the medical superintendent. But they said, to develop the hospital, this is very much required. Probably later on it may not continue, but at this time it is very much required. That's why I am continuing. It is for you people to take it forward and develop the hospitals. Like that, so many things. I had a lot of cooperation from the staff, from top to bottom, whether it is principal, whether it is hospital wardens, doctors, professors, and the clerical staff, and the other important staff I cannot forget is the class 4 staffs who were cleaning the hospitals and making the hospital clean, whom I thank them so much. I cannot, some of them are, they respect me so much, and even now if there, some of them are there, they come and talk to me. So these were some of the things. The development is a continuous process. Now, Dr. Mr. Vishal was telling that this development of the hospitals, development of infrastructures in the hospital, development in the rural areas and all these things. Probably, I again stress there are so much to be done in the, especially rural areas at the district levels. Whatever is available in the Bangalore in some of the developed hospitals, the same developed facilities should be developed or made available to the patients in the district hospitals. All the facilities should be, patients should not be going to Bangalore or any other bigger places for things. And things should be available in all the districts. Everything should be available at the district level. This is my request. Probably Dr. Vishal may convey it to the government and take it forward. ಈ ಅವಕಾಶಕ್ಕಾಗಿ ನನಗೆ ನಿಮಗೆ ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳ್ತೀನಿ. Thank you very much.
Thank you, sir, for sharing your insightful journey. We now invite Dr. Manjunatha GV, Consultant Purchase Officer, to address the gathering. Please welcome, sir.
It's already time now. I don't want to take much time, just in 5 minutes I will finish it up. So on the centenary occasion, the chief guest of this occasion, Shri Dr. Vishal, I have been associated with him since 12 years. The most eminent, pro-poor, pro to the society IAS officer I have seen in my lifetime. Honestly, I am telling you, it is, sir, it is a great opportunity for this academy to have you on this occasion. And Dr. Srinathan is an godfather to me when I was doing my medicine, and now he is the chief guest of this occasion. So for him also, I prostrate before all the people. So chief guest of this today's function and all the dignitaries on the dais and the students, all the professors, associate professors and HODs and all the staff of this academy and this university and hospital staff. Today we are celebrating the great founder of this institution, R.L. Jalappa ji. It is a long journey. See, I was associated with him since 1987. I was appointed in this institution as an orthopedic surgeon, but the department was not existing in this hospital. So he posted me in anatomy department as lecturer. Those days, lecturer, then assistant professor and professor, not like what we have now. So when I was working, only we were 20 persons in this institution. Now this institution has grown like a banyan tree with all the branches everywhere. So it is the commitment of the chairman and also the trust, how they dedicated for the upliftment of this hospital and this institution. Actually, only 2 sheds were available. Still, I remember only anatomy professor Krishna Rao was there, and one lecturer, I was a lecturer. And then later, Shetty has come as a biochemistry, and then Ramchandra has come as a physiology professor. Only the staff, and our office was on the Gramina Bank, first floor was the office in the Doomlight Circle. See, this is how the institution has developed. And regarding Jalappa ji, everybody, Lakshminarayana Jalappa ji, See, you're all aware of her. He's a veterinary leader, educationist, philanthropist, everything. Apart from that, one thing I would like to enlighten you is a great human being. But for people is to look like a very tough man. The way he talks, it looks he is very arrogancy, like thing we feel. But his looks were like that, but he's very kind-hearted. ನಿಮಗೊಂದು ಎಕ್ಸಾಂಪಲ್ ಹೇಳಬೇಕು ಅಂದರೆ ವೆನ್ ಹಿ ವಾಸ್ ಇನ್ 98, he was a central minister. I was with him for 8 days. Every day we used to go join for breakfast. One day I asked him, ಏನೇ ರಾತ್ರಿ ಎಷ್ಟೊತ್ತಾದರೂ ನೀನು ಮನೆಗೆ ಬರೋದಿಲ್ಲ, ಯಾಕೆ ಇಷ್ಟು ಲೇಟ್ ಮಾಡ್ತಾ ಇದೀಯಾ, ಇವತ್ತು ಡಿನ್ನರ್ಗೆ ಜಾಯಿನ್ ಆಗು. ಆಯಿತು ಸರ್, ಇವತ್ತು ಬೇಗ ಬರ್ತೀನಿ. So 8 o'clock I came. He was not there. Then the cook Narayan said, sir, ಸಾಹೇಬ್ಲಿಗೆ ಬರಲ್ವಂತೆ, ನೀವು ಡಿನ್ನರ್ ತಗೊಳ್ಳಿ. Then I thought, anyhow, you will come late. So ನಾನು ಇಮಿಡಿಯೇಟಾಗಿ ಬರ್ತಾರಲ್ಲ ಅಂತ ಸುಮ್ಮನಿದ್ದೆ. After that, he came all the from Andhra Bhavan. That day, the Prime Minister, Devegowda, was resigning and Gujarat is becoming Prime Minister. He was in meeting. All the way came down to his residence and he has given me the key and said, ನಿನ್ಗೇನು ಬೇಕೋ ಆ ರೂಮಲ್ಲಿದೆ ತಗೋಪ್ಪ, ಊಟಕ್ಕೆ ನಾನು ಬರೋದಿಲ್ಲ, ನನ್ನ ಮೀಟಿಂಗ್ ಇದೆ, ನಾನು ಅಲ್ಲೇ ಊಟ ಮಾಡ್ತೀನಿ, ನೀನು ಹೇಳ್ಬಿಟ್ಟು ಹೋಗೋಣ ಅಂತ ಬಂದೆ. ಸಿ, ದಟ್ ಈಸ್ ದ ಕನ್ಸರ್ನ್ ವಾಟ್ he had. So people, he had a great concern for poor people, for the public, and even in his life. And he never let his self-respect anywhere. For that one small example, when we went for his swearing ceremony, so he was sworn as a minister of state. Then immediately he resigned with the slip and he came down from there. Resignation he has given. And then we in the room we asked, ಯಾಕೆ ಸರ್ ರೆಸಿಗ್ನೇಷನ್ ಕೊಟ್ರಿ? ನನಗೆ ಇಷ್ಟ ಇರಲಿಲ್ಲಪ್ಪ. ಸರ್, ಯಾಕೆ ಮೊದಲೇ ಕೊಡ್ಬೋದಿತ್ತಲ್ಲ? I don't want to insult the constitution. That's why I didn't resign on the, I took oath and after coming out from this thing I have given resignation. This is how, and most of the times Dr. Srinathan is here. That time there was more professor, I think Swami was there, one more professor was there. There was no vacancy. And when I went to his house, see, it is a heavy burden to take professor. Then I said, sir, ಅವ್ರು ನನ್ನ ಫೀಸ್ ಕಟ್ಟಿ ಊಟ ಹಾಕಿದ್ದಾರೆ, ಅಂಥ ಒಂದು ಟೀಚರ್ನ ತಗೊಳ್ಳೋದು ನಿಮ್ಮ ಅದೃಷ್ಟ, ತಗೊಳ್ಳಿ. ಏಯ್, ನಿಜ ಹೇಳ್ತೀಯನಪ್ಪ ನೀನು ಅಂದರು. ಎಸ್ ಸರ್. Then immediately appointed. That's how he's a great human being, how he was acting. And he was very strict also. And he has come in his life from actually after his graduation, he has become PLD Bank, first time as a president, and then he has become district bank president and Apex Bank director. Then he was an MLC in Devaraja's college time, and then he has become cooperative minister, and then he was an home minister, then he was an revenue minister in Devegowda's regime, and then he was an textile minister, and he was MP almost more than 20 years. So his journey, and always used to say, hey, ಕೋಲಾರ ಡಿಸ್ಟ್ರಿಕ್ಟಲ್ಲಿ ಇರೋರೆಲ್ಲ ಬಡವರಯ್ಯ, ಅವ್ರಿಗೇನಾದರೂ ಸರ್ವಿಸಸ್ ಕೊಡಬೇಕು ನಾವು ಅನ್ನೋ ರೀತಿಯಲ್ಲಿ ಮಾತಾಡ್ತಾ ಇದ್ರು. ಅಂದರೆ ಇಸ್ ಪ್ರೋ ಫಾರ್ ಪೂರ್ ಪೀಪಲ್. Now on this occasion, this institution has grown. We are all, I will extend on behalf of all the academy and all the students, and my great tribute to that great soul. Thank you, one and all.
Thank you, sir. We are privileged to have with us the Vice Chancellor of the University, Dr. B. Vengamma ma'am. We request you to deliver the presidential address.
Good afternoon to everybody. Anyhow, we are behind the schedule. I'll try to finish it fast. Respected dignitaries, esteemed guests, today's chief guest, Dr. Vishal R., and guest of honor, Dr. R.N. Srinathan, and Dr. N.K. Venkatramana, and other members of our faculty and non-faculty members of Sri Devaraja's Academy of Higher Education, my dear students and dear friends. It's both honor and privilege to stand before you as the president of today's function, a momentous occasion, centenary celebration, birth celebration of our beloved founder, Sri R.L. Jalappa, as a hospital day. This 100 years ago, this visionary was born, a man whose legacy we continue to live, breathe, and build even up to today. Sri R.L. Jalappa was not a just name, it was a movement, a beacon of hope, crusader for the rural development, above all, advocate for accessible quality health care and education. Today, as we gather under this roof, let us not only celebrate his birthday, but more importantly, let us reflect upon and renew our commitment to the values and vision he dedicated his life to. When he was born in 1925, when access to health care and higher education was a distant dream for a rural population, but rather than accept the status quo, he chose to challenge it. He wore many hats like a freedom fighter, leader, parliamentarian, philanthropist, but at the heart of all his roles was a single driving purpose to uplift the society through service. And it was with this purpose, I think, he founded Sri Devaraja's Educational Trust, later Sri Devaraja's Medical College, and then subsequently in 94, Sri R.L. Jalappa Hospital and Research Center, and also Sri Devaraja's Technology College. The vision behind this hospital was simple yet revolutionary. Healthcare should not be a privilege for few, but right for all. Established with the goal of bridging the rural-urban healthcare, R.L. Jalappa Hospital today stands tall as a center of excellence in patient care, medical education, research, as you could see the report through medical superintendent. Thousands of lives have been touched, healed, and transformed within the walls. This wouldn't have been possible without tireless efforts of all the faculty from its inception who worked in this organization, and its effort of Sri R.L. Jalappa, who believed in empowering the institutions, not individuals, so that their impact could live for generations. Even 100 years after his birth, the values he stood for, integrity, service, social justice, and education, continues to guide our journey. His leadership was never about the power, it was about the purpose. He was never satisfied with the temporary solutions, he aimed for sustainable change. And in every initiative he took, from a cooperative movement to educational reforms, he's always beat for a common man, poor man. In a world increasingly driven by the personal gain, his life reminds us power of selfless service. As a students, doctors, nurses, researchers, administrators, faculty of this organization, we are not just part of an institution, we are the custodian of a legacy. Every patient we treat with the compassion, every student we train with the integrity, every life we save, we are keeping the founder's dream alive. The best tribute we can offer Sri R.L. Jalappa ji is not a statue of our ceremonies, but in action. Let us strive to build institutions that are inclusive, ethical, and committed to excellence, just as he was in his vision. On this centenary, let us take a moment to thank not just the man, but the mission he began, a mission that each one of us is a part of it. Let us also thank his family and the trust and colleagues, countless individuals who worked with him, helped shape this organization. To conclude, I just borrow the words of Mahatma Gandhi: the best way to find yourself is to lose yourself in the service of others. Sri R.L. Jalappa not only found himself, he also found a way to transform lives of the people, thousands around him. As we celebrate 100 years of legacy, let us remember this is not a just milestone, it is a call to action, a call to build, to serve, to uplift, just as he did. Let us walk forward together with his values in our heart and his vision as a guide. Let us pledge that today from onwards we will try to keep up his visionary to bring the uplift of this organization for the welfare of the society. I once again thank our chief guest, Dr. Vishal R., and guest of honor, Dr. R.S. Srinathan sir, for taking their time, accepting our invitation, and I wish you all the best, and I really congratulate Medical Superintendent Office for organizing this wonderful program. Wish you all the best. Thank you. Jai Hind.
Thank you, ma'am. Let's now take a moment to honor the dedication and service of our committed employees. We proceed with the felicitation ceremony. I request Dr. Samudyata to take over.
Thank you. It is with immense pride and pleasure that I now request the members of the staff who have served the institution for more than 20 years to come onto the stage to receive the felicitation. I request the dignitaries on the stage to felicitate these staff members. Sir, please. Ma'am, please. Dr. Dayanand C.D., Professor and Head of Allied Health Sciences, SDUAHER. Dr. Rajshekhar T.S., Professor and Head, Department of Dermatology, SDUMC. Dr. Shubhasis Das, Professor, Department of Pathology, SDUMC. Kamala Sekar, Teacher, RLJ Central School. Mr. Yatish A., General Manager, Engineering Section, SDUMC. Dr. Suresh T.N., Professor and Head, Department of Pathology, SDUMC. Dr. Dayanand C.D., Professor and Head, Allied Health Sciences, has served the institution from 2005. Dr. Rajshekhar T.S., Professor and Head, Department of Dermatology, has served the institution since June 2005. Dr. Subhashis Das, Professor, Pathology, SDUMC, has served the institution since July 2005. Kamala Sekar, Teacher from RLJ Central School, has served the institution from 2005. Mr. Yatish A., General Manager, Engineering Section, has served the institution from April 2005. And Dr. Suresh T.N., Professor and Head of Department of Pathology, has served the institution since February 2006. A round of applause for this dedicated staff, please. I now request the non-teaching staff to come onto the dais to receive the honor. Mr. Suresh K., Attender, Department of Orthopedics, SDUMC. Mrs. Kavita K., Lab Technician, Grade C, Department of Biochemistry. Anjanappa C., Cook, President's Office. Bhaskar P., Lab Technician, Grade C, Central Diagnosis and Laboratory. Manjula Devi K., FDA Senior Grade, MS Office. Chandrappa K., FDA Scheme Counter. Mr. Suresh K. Attender, Department of Orthopedics, has served the institution since 2004. Kavita K. Lab Technician, Grade C, Department of Biochemistry, has served the institution since February 2005. Anjanappa C. Cook, President's Office, has served the institution since March 2005. Mr. Bhaskar P., Lab Technician, Grade C, Central Diagnostics and Lab, has served the institution from April 2005. Mrs. Manjula Devi K., FDA, Senior Grade, MS Office, has served the institution since January 2005. Chandrappa K., FDA, in the scheme counter, has served the institution since March 2005. A big round of applause for the staff, please. I now request Ms. Esther Rani B., Senior Nursing Officer, RLJ Hospital, Mr. Shankarappa M., Dobi, RLJ Hospital, Mr. Nagesha B.S., Sanitary Worker, RLJ Hospital, Mr. Papanna, Sanitary Worker, RLJ Hospital, Mr. Suresh Babu A., Plumber, Engineering Section, SDMC, and Mr. Venkatesha J., Attender, RLJ Hospital, to please come up on the stage. Mr. Esther Rani B., Senior Nursing Officer of RLJ Hospital, has served the institution since June 2005. Shankarappa M., Dobi, RLJ Hospital, has served the institution since June 2005. Nagesha B.S., Sanitary Worker in RLJ Hospital, has served the institution since 2005. Mr. Papanna, Sanitary Worker, RLJ Hospital, has served the institution since 2005. Mr. Suresh Babu A., Plumber, Engineering Section, SDMC, has served the institution since 2005. Mr. Venkatesha J., Attender, RLJ Hospital, has served the institution since 2005. Thank you for your service. I now request Mr. Tippaya PD, Sanitary Worker, RLJ Hospital, Mrs. Netravati A., FDA, Nursing College, Harish V., Assistant in Pharmacy, Mr. Devraj N., Cleaner in Vehicle Section, and Mr. Bhimana ND, Lift Operator, Engineering Section, to receive the felicitation. Mr. Tippaya PD, Sanitary Worker of RLJ Hospital, has served the institution since September 2005. Mrs. Netravati A., FDA, in Nursing College, has served the institution since August 2005. Mr. Harish V., Assistant in the Pharmacy, has served the institution since December 2004. Mr. Devraj N., Cleaner in the Vehicle Section, has served the institution since January 2005, and Mr. Bhimana, Lift Operator of Engineering Section, SDMC, has served the institution since July 2005. Thank you for your service. I thank the dignitaries for honoring our dedicated staff. Thank you.
Dr. Vishal sir wants to answer your questions. If anyone have any questions, you can. One question.
I'm sorry again, I'm coming in. One young guy came up. I took the Vice Chancellor's permission before. He stated, we are all youngsters here, sir. Why the IAS? Why the administration? In fact, that is a usual question which I get. Simple as that. You have to decide what you are good at. You may be a brilliant neurosurgeon like Dr. Venkatramana. Okay, I did neurosurgery. It did not fit me. I may have been just a normal neurosurgeon. But Dr. Venkatramana is a brilliant neurosurgeon. So try to be good at what you are. Work on your strengths. You ಒಳ್ಳೆ cook idre, be the best cook in the world. You're a good nurse, be the best nurse in the world. If you're a good administrator, try to be the best in that, okay? This is one. Second, the IAS, the UPSC exam is an extremely competitive exam. You need to put in, people say use smart work. Smart work is the third step. First step is capability. Second step is hard work. Third is smart work. So you need to prioritize and take your subjects. Third, it's a dedication, ಇದೊಂದು ತಪಸ್ಯ 3 ರಿಂದ 5 ವರ್ಷ. ಸೊ ಮಾಡಬೇಕಾಗ್ತದೆ. ಅಷ್ಟು ನಿಮ್ಮಲ್ಲಿ ಹುನ್ನಾರಿದ್ರೆ ಮಾಡೋದಿದ್ರೆ ದಯವಿಟ್ಟು ಮಾಡಿ. ಇಷ್ಟೇ ಹೇಳಲಿಕ್ಕೆ ಬಯಸ್ತೇನೆ. ಥ್ಯಾಂಕ್ ಯು.
Thank you, sir. To express our gratitude and bring this formal session to a close, I invite Dr. Rajkumar M. G. Sir, Deputy MS, RL Jalappa Hospital, for the vote of thanks.
Good afternoon, everyone. So finally, we have arrived at the important stage of the function. It is both an honor and a privilege to extend the vote of thanks on this august occasion, the centenary birth anniversary of late Sri R.L. Jalappa, the visionary who transformed the philanthropy into pedagogy and compassion into a living institution. First and foremost, on behalf of the organizing committee and the entire hospital fraternity, I extend our heartfelt gratitude to our chief patrons and trustees of the academy. Thank you, sirs. On behalf of Sri Devaraja's Academy of Higher Education and Research and R.L. Jalappa Hospital and Research Center, I express our deepest gratitude to our chief guest, sir, Dr. R. Vishal, sir, whose journey from medicine to administration epitomizes the rare confluence of intellect and public service. Thank you, sir. And Dr. R. Srinathan, sir, the eminent scholar and former dean whose lifelong dedication to the sciences of mind and body continues to enlighten the generation. Thank you, sir. We are deeply indebted to our Honorable Vice Chancellor, Dr. B. Vengamma, for presiding over today's ceremony with the characteristic vision and the grace. Thank you, madam. Our gratitude extends to Dr. D.V.L.N. Prasad, Dr. C. Muninarayana, whose administrative acumen ensures the founder's mission and endures the vigor. Thank you, sirs. So through the organizing committee, Dr. K. Prabhakar, Dean, Principal, SDHR, Dr. G.V. Manjunatha, the Procurement Officer and the Purchase, Advisor to the RLJH and RC, Dr. J. Krishnappa, sir, who is the main architect of the event, Dr. K. Dinesh, sir, who is also called as the right hand to the medical superintendent. Thank you, sirs. Your seamless orchestration has made this celebration a fitting tribute to the founder's centenary vision. Thank you, sirs. I'd like to extend my deep, heartfelt gratitude to all principals of our sister institutions. To the faculty, staff, and students, your dedication forms the invisible thread that binds our institution to the past glory to promising future. I also thank all the former medical superintendents for gracing the occasion and for sharing your memories, sir. Thank you, sirs. Last but not least, I extend a special vote of thanks to Mr. Sumant, the Assistant Registrar SDHR, for his active participation and coordination, making this hospital a grand success. Thank you, Suman. As we close this memorable day, let us carry forward the founder's luminous legacy to wed learning with empathy, science and humanity, the progress with a moral purpose. May the ideals of late Sri R.L. Jalappa continue to guide us, not merely as echoes of the past, but as the beacons of the future. Thank you, one and all, for your presence, participation, and goodwill. Jai Hind, Jai Karnataka. A special mention here, the lunch being arranged at 3 different venues. The non-teaching staff, it is arranged at the Neem Park. For teaching staff, it is arranged at APJ Abdul Kalam. For chief guests and the dignitaries, it is being arranged at Academic Council Hall. Thank you, one and all. University. I request everyone to rise for the national anthem.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे जन
Thank you all for being a part of this special day. Let us carry forward the vision and legacy of late Sri R.L. Jalappa ji with renewed spirit and commitment. Wishing you all a great day ahead. And also it is our principal sir, Dr. Prabhakar sir's birthday today. We wish him a very happy birthday. Prabhakar sir's birthday it is. Thank you all.